You should be out when you go safety.
But now, what's your name here?
Ce n'est pas moi d'écrire quelque chose. Could you measure my do fund? I'm not changing the fund. Yes. Me fund da gaita mas. Cocoa tento.
We were all designed for the top. So you know, and let's see what we're looking at. You know, talk about it.
There's other people, yeah. This is not. There's other people. I think they're on the meeting.
How do you put it into an thing on my Zoom profile?
I don't know. You do it before. Not the
Good morning, everyone. I'm not sure if you can hear me at all, but a very good morning to you all. I think we can make a start. You cannot hear me. I sound like I'm whispering. Okay. There's a bit of an echo. Could I ask if you have a laptop? Can you, thank you. May you kindly switch it to silent, just so it doesn't interfere with the sound system. But is this any better? You can hear me now. Okay, I'll try to speak a little bit louder. Okay. So a very good morning to you all. So those of you that are joining us in person and those of you who are joining us online, welcome to the 10th Annual Disability Rights in Africa Conference. So my job is really simple this morning, just to introduce the speakers that will be addressing us in the introductory session. So first, I would like to introduce our director. Sorry. Okay. Okay. Okay, thank you. Thank you very much. So I would like to introduce our first speaker. He is the director of the Center for Human Rights, Professor Frans Viljoen, and he will deliver the welcome remarks on behalf of the center. Thereafter, he will then introduce the Dean of the Faculty of Law at the University of Pretoria, Professor Elsa Biskuman. It is my pleasure to welcome Professor Frans Viljoen. Thank you.
Thank you very much, Diana. And a warm good morning to everyone here in the room with us. You are most welcome. I think this is also a motion of confidence in being together in person. Thank you in particular for those of you who are able to join us in person here today. This is the first time that we are back in person for these conferences. But equally for those of you online, we really appreciate your presence, even if it's a virtual presence. We know it's sometimes even more challenging to be joining when there are so many contending demands. We also appreciate you and welcome you very warmly to this conference. For us at the center, nothing is possible without a team working on it. And I want to acknowledge Diana Sipa, who is the manager of the Disability Rights Unit in the center, together with her team, and Jahira, Paul, Sabiha, and many others in the center who assisted, just to acknowledge and congratulate you in getting us all together and to putting this program for us together. I also want to welcome and thank Professor Elsa Biskuman, whose name has been mentioned. The Center for Human Rights, of which I'm the director, functions as an academic department within the Faculty of Law. And we have been fortunate to receive a warm and continuous support from the Faculty of Law. Now, Diana mentioned that this is the 10th of these conferences on disability rights in Africa. And I really think it is a milestone to be celebrated because, among other things, we have been able to present these conferences without interruption for the last 10 years. And given all the challenges of the world that we faced, I think in itself, it is no mean feat. For us as a Center for Human Rights, we see ourselves as having a mission and vision that is dual. On the one hand, I mentioned that we are an academic department. We are striving to complement and further African scholarship on issues of human rights in Africa. But secondly, we are also a human rights institute that tries to advance the rights of the most marginalized in Africa within our center. We do research, advocacy, and capacity building projects in which we try to achieve this objective. Now, those two aspects of the center are very well combined in this conference, because on the one hand, we are trying through the conference to advance scholarship, African-based, African-focused scholarship on issues of human rights. And I think each of you here in the room and others virtually, you'll receive also a copy of the African Disability Rights Yearbook. Many times the presentations at this conference find their way to the African Disability Rights Yearbook. And we hope to have contributed to have this constant flow of scholarly contributions on important and contemporary aspects of human rights related to persons with disabilities in Africa. But on the other hand, as I said, we try to advance the rights of the most marginalized. And I think we try to do this through a lens of intersectionality. If you look at the previous conference themes, you'll see that we look at the intersection between disability and youth, gender, sexual, gender rights, and so on. And in this conference, we are aiming to focus on a very neglected intersectional aspect, and that is persons with disabilities who find themselves in positions of forced displacement. If you look at the scholarly literature, if you look at programmatic work within the agencies, you would agree with me that there is actually quite a dearth, a lack of serious scholarly and programmatic engagement on this intersection between disability and displacement. And I think from our cursory and kind of anecdotal view of the landscape, we would all agree that probably one of the most marginalized segments of communities that are already marginalized would be persons with disabilities who are forcibly displaced, refugees with disabilities, internally displaced persons with disabilities, asylum seekers with disabilities are often bearing the brunt of very, very acute intersectional forms of marginality. And I think what we see in the limited literature and the limited programmatic work is that there's often a homogenized way of looking at refugees or internally displaced persons. There's infrequently any kind of disaggregated view within the context of displacement. So there hasn't been this sensitivity awareness of how disability manifests itself as an acute ground for the exacerbation of marginality within this context. So for all of these reasons, I think we are fortunate to be together, to reflect, to interrogate, to critically think about the aspects around the topic which I just referred to. Now, as a center, we also try to advance norms. We try to advance the ratification of treaties. Now, one treaty I have to mention here is the protocol to the African Charter on the rights of persons with disabilities in Africa. I think many of you know the UNCRPD, but this African protocol is less known. It is not yet in force because, as I think most of you here would know, it requires 15 ratifications for its entry into force. And so far, only 3 states, pardon me, have ratified. That would be Kenya, Mali, and Rwanda, as far as the AU official statistics are concerned, at the very least. So South Africa has not, maybe the state from which you are has not. We urge, and we hope through these days together, we will also bring out the added value of this African Disability Rights Protocol. I can just mention that in its Article 12, this African Disability Rights Protocol focuses also on particular situations of marginality, and their displacement is officially and expressly recognized as well. So that's one of the reasons, one of the many reasons why I think we should, as Africans, engage, advance, and advocate for the ratification of this Disability Rights Protocol. With these few remarks, I wish you all a very insightful deliberation, discussion here, and I hope that together we can strengthen or advance those two objectives: enriching African thinking and scholarship on this important topic, and in the process advance in a very real and tangible way the rights of persons with disabilities on our continent. It is now my pleasure to introduce and ask Professor Elsabe Skuman, the Dean of the Faculty of Law, to also, on behalf of the faculty, direct her words of welcome to you. Professor Skuman, we are very fortunate. We know that in an ordinary course of event, you would be here with us, but you have a very pressing program, so we appreciate your presence virtually. And as I've said before, we appreciate your personal and the faculty's support, not only for the Disability Rights Unit's work, but for the center's work in general. Over to you for your welcoming remarks, Professor Skuman. Thank you.
Thank you very much, Professor Viljoen. Can you hear me clearly?
Yes, yes, thank you.
Okay, thank you. Thank you very much. And yes, first of all, my sincere apologies that I can't be there in person. Today, as you know, was preferred to attend the center's events in person, but due to a congested diary today, it is not possible for me to commute easily between Joburg and Pretoria. But thank you very much for inviting me to do the opening address today. Yes, as Dean, I'm always very happy to engage with the center and with the activities and conferences. And when I look at their schedule, it's always a very, very hectic one. So I know that there are very, very committed staff working in the center, and also know that they depend a lot on collaborators. And so also want to thank everybody present here today, also for the contributions that you are making from wherever you may be. As we've heard today, it's the 10th anniversary of this conference. And as Professor Viljoen pointed out, throughout COVID, the conference took place, which is really important and says a lot. Over the past 10 years, we've had different conference themes. The first one was on implementing the Convention on the Rights of Persons with Disabilities in Africa. That was 2013. Then we had Women with Disabilities in Africa. That was in 2014. Then we had Children with Disabilities in Africa, 2015. In 2016, the theme was Advancing the Rights of Persons with Albinism in Africa. 2017 saw the conference focus on access to justice and legal capacity. 2018, it was about inclusive education, living independently in the community. That was the theme for 2019. Then 2020, it was right to health. And last year, sexual and reproductive rights. So a very broad series of topics that have been addressed through these past 10 years. Now, this year, as you heard, the conference will interrogate the impact of migration and displacement on the enjoyment of human rights by persons with disabilities in Africa. As we see around us, armed conflicts, climate change, and food shortages, those are among the many factors that force people throughout the continent, including persons with disabilities, to migrate within and across borders in search of security and better prospects. Now, although a substantial amount of research has been conducted on the human rights violations against certain groups of migrants and internally displaced persons, including women and children, very little research has been conducted on the intersection between migration, displacement, and disability. Anecdotal evidence indicates that persons with disabilities who migrate or are displaced experience a disproportionately higher level of human rights violations. And it's against this backdrop that the objectives of this conference are twofold. First, to critically appraise laws, policies, practices, programs, polities, and ideologies that relate to migration and displacement of persons with disabilities in Africa. And secondly, to suggest remedial responses domestically, regionally, and globally to address violations of the rights of persons with disabilities as migrants and internally displaced persons. So over the course of the next 2 days, presenters will share their research, their knowledge, and the experience of how to ensure that migrants and internally displaced persons with disabilities can enjoy human rights and fundamental freedoms on an equal basis with others. It's therefore a great pleasure for me to declare this annual Disability Rights in Africa conference open. And I wish you all very, very fruitful discussions and also networking, as always, meeting up with people. We know that with our in-person conferences now, it is also possible to have those interesting discussions around the coffee table or during lunches and dinners. So from my side, I wish you all the very best with this conference. When I see what the previous conferences have produced, then I have no doubt that this one will even surpass that. Thank you very much, Professor Viljoen.
Many thanks to Professor Schoeman and to Professor Viljoen for the welcome and the opening addresses. At this stage, I would like to introduce our keynote speaker. Her name is Goretti Biomire. She's a lecturer and director of the Disability Resource and Learning Center at Makerere University Business School. She's also an alumnus of YALI Mandela Washington Fellowship and currently serves as the chairperson of the Mandela Washington Fellowship Disability Inclusion Working Group. She is a disability and gender research and consultant, and has also engaged in disability advocacy, inclusive education, health, digital technology, STEM, employment, livelihoods, energy, disasters and emergencies, climate change, gender-based violence, SRHR, that's sexual and reproductive health and rights, as well as refugees. She is also the CEO and founder of Biomira Inclusive Development Foundation, whose vision is to have an empowered, resilient, and inclusive society. Goretti sits on other boards, including the MUBS School Council, the MUBS Management Committee and Technical Advisory Disability Committee. She also mentors and trains people in diversity, equity, and inclusion. She's a member of the Commonwealth Disabled People's Forum and a member of the Inclusive Education Initiative Group by the World Bank and the Lions Club International. Goretti is the second vice president of the Lions Club, Kampala New Century, and she is the winner of the top 20 females and top 40 under 40 in 2022, persons impacting the lives of others and communities in Uganda. She has quite a long and impressive biography, so I think I'll have to cut it short. Yomiro, you will forgive me for that, just for the sake of time. I think I pointed out the highlights, the most important parts, but at this stage, can I invite you to take the stage and deliver your keynote address? Thank you.
Good morning, everyone. I'm quite very happy and excited to be here. Presentation. Technical team to be able to run the presentation. So can you begin from the first slide? All right, thank you once again. Okay, I'm going to be, my keynote address is going to be about the lived and shared experiences and the impact of disasters and emergencies on migrants and displaced persons with disability. I'm Biomira Goretti. I'm the chairperson for the Mandela Washington Fellowship Disability Inclusion Working Group. I'm also from Uganda. Okay, they have said so many things about me. I hope you heard them. But most importantly, within this space, I lie both in the academia and also in civil society. And I'm also a PhD student candidate at the University of South Africa, and hoping that next year I'll be able to graduate. Okay, so we are going to be looking at, we're going to be talking about migrants and internally displaced persons. Internally displaced persons are persons who, for one reason or another, just a moment. One of our the sign language interpreter. Sorry. Is everything well? Just a moment. Okay, thank you. Everything is well. So our theme for this year is on migrants and internally displaced persons. Internally displaced persons, a person who, for one reason or another, whether it is war or whether it is conflict or disasters and emergencies, they are displaced from their homes. They have to run and move away from their place, from their places of residence or homes. But most of the time it's within the country and they are still under their governments whereas migrants or refugees, they are displaced from their countries. They have to run away from their countries for one reason or another. And then still, when we have migrants or internally displaced persons, we also have persons with disability who may be, for one reason or another, be displaced. So most of the times, when it comes to internally displaced persons with disabilities and migrants, their challenges are quite very unique because remember, disaster just happened, war or conflict happened, no one has control over it. So you find that most of the time they are left behind, they face discrimination, they're already facing discrimination on the part of the fact that they are persons with disabilities. Now it gets worse when disaster strikes. And even when we have the emergency response team, the first aid teams, aid and development providers, persons with disabilities are the last persons to be thought about. They will first think of everyone else, and then they will think later about persons with disabilities. Most of the time, they are also not involved or they don't participate in any decision making. And one of the biggest emergency that's happened recently was COVID-19. And COVID-19 really, we thought that, okay, we had made some steps in disability inclusion, but COVID-19 brought out the grim reality that, you know, there are certain things which have not been corrected. So COVID-19 heightened the challenges faced by migrants and internally displaced persons. They were left behind on so many things, policy protection, humanitarian assistance, and enjoyment of human rights. So we have the UNCRPD, the United Nations Convention on the Rights of Persons with Disabilities, and we have so many countries that have ratified it, even in Africa. And Article 11 of the UNCRPD reinforces and specifies that states have to ensure protection and safety of persons with disabilities in terms of humanitarian situation, armed conflict, and risk. We have the African Disability Protocol, the one which Professor, I'm sorry, I can't pronounce your name, but one who was talking about. So it is a call to leave no one behind. And Article 12 still specifies that persons with disabilities should be consulted and participate in planning, implementation, and monitoring of pre- and post-conflict reconstruction and rehabilitation. So we have so many, I will not mention them, we have so many laws, registration that really promote or advocate for persons with disabilities to be included in disasters, in emergency situations. However, these laws have not been implemented. And then I'll give an experience of, I'll give experiences of internally displaced persons with disabilities from the COVID-19 response. So like I had said earlier, the pandemic highlighted that there are already existing inequalities of persons with disabilities. They were not prioritized during the pandemic, and discrimination was quite very present during the response, the efforts. And most of the time when you looked at, we had in place COVID committees, COVID task force, but you find that persons with disabilities were not a part of those teams that we are planning for the country, that we are planning for agencies. And then when the lockdown was enforced, we had only essential services in place. However, essential services for persons with disabilities were not included in the list of essential services, such as fixing a wheelchair, sign language interpretation, and so on. So persons with disabilities were left behind and their needs were not considered. This one is an example of Uganda. In Uganda, unfortunately, we had militarization of the COVID-19 response, and we had, for instance, the first time that pandemic was declared, it was when we had the lockdown, somewhere between like 8 p.m. There was a curfew which was announced. So that curfew was starting at 10 p.m. So the first televised recordings or the first talks, they did not have anything like sign language interpreters. So some persons who are deaf just woke up the next day just to realize that, okay, now we are under curfew, no moving. They just woke up overnight and the public transport was not there. Everything was restricted because they had not gotten that information. So movement was banned. They could not access any information. And then to make matters worse, okay, we had the police enforcing, and then we also had what we call the local defense unit in Uganda who are enforcing this restriction. This person had no training in any disability inclusion, and for them it was just all a matter of enforcing the restrictions of COVID-19. Whether someone is disabled or not, they wouldn't listen to anything else. So we have a deaf man who was shot, who lost his leg. This gentleman, the curfew or the lockdown was instituted in the night. So after it was instituted at 10 p.m. So they phoned him, the local defense unit, they phoned him walking at 11 p.m. So they tried to stop him, and he couldn't because he was deaf. He couldn't hear. So they tried to communicate with him and he couldn't. So they just opened fire on his leg. So they shot him. And later on, he was taken to the hospital. But because his leg was seriously damaged, he had to be amputated. And then he lost his leg just like that. And then also the psychological trauma. But it was just something very small. These are things that that policymakers really take for granted and don't think through. So this is something that happened, which shouldn't have happened, and it was very bad. Okay, continuing, we have information. Persons with disabilities have different information needs. They get information from different people, from different sources during humanitarian situation. So in my study, because my PhD study actually is about information sharing, information needs, information access for persons with visual, hearing impairments, intellectual and development disabilities during disasters and emergency. And it has been quite a very fulfilling journey for myself as someone who is in between academia and civil society. Persons who are deaf, they share that for them, they don't receive the information about disasters firsthand. They usually receive from maybe a relative, a caretaker, and by the time they get that information, it's miscommunicated, it's distorted, and they always get information late after everyone has received it. You saw the example of the gentleman who was shot. Persons with visual impairments rely on information from radios, TV, and community halls. And they say that they were not satisfied because yes, there's someone telling you, okay, we have a disaster, ABCD, or this place is going to receive floods. Then you also have to communicate and say, well, if you're a person with a visual impairment, try and do this and this and this. Or if you have if you're hard of hearing, do ABCD. So the information comes about the disasters, about the emergency, but no information comes specific to the different persons with disabilities, what should you do in this place? So this is something that is missing that needs to be addressed. And then each disability is different and each disability has its own needs. So during emergencies and disasters, these needs are not normally taken into consideration. So sometimes it becomes quite a challenge for different impairments to access information. And then remember, we have disasters and emergencies. Some people, the first aid responders or response teams are not trained to communicate in sign language or in Braille, and they find it quite very difficult to interact with other people. And these days we still have COVID-19, then there's Ebola that is coming up. So there's use of face masks. Now, persons who are deaf or hard of hearing find it quite very difficult to read the lips because the mask is covering the lips. So these are the communication challenges that still face persons with disabilities during humanitarian situations. So as I close, as academia, I know some of you here from academia, others are from civil society. We thank civil society for your role that you have done. However, with civil society, sometimes members from civil society make reports, and these reports are shelved, and then that is it. So it will be prudent, it will be nice to have, because the data that we have about disability is quite very limited. It will be very nice to have these reports published and out there, so we can be able to form policy based on this report. And then we have many universities from the global south. We have academia. We have a lot of money that is still being poured in research, and disability is a cross-cutting. It's cross-cutting. So you can do disability research in every way possible. I would like to interest the academia. Can you please interest other people in your circle? Can you interest other universities, other professors, other scholars? Can you interest them in doing research in disability? Can we have working groups? You know, we could have disability research working groups from different countries, from different universities. That way we shall be able to collect disaggregated disability data, and this data will help us in informing policy and decision. We could start out with carrying out baseline studies in the different countries, establish what is taking place in that country. Do they know about the African Charter and the UN CRPD? What are the gaps? What is happening? What do we need to do? So all this is something that the academia needs to do so that it will help to inform about the rights of migrants and persons with disabilities during post-conflict and humanitarian situations. Thank you.
Thank you very much for that address, for that presentation. For our very first substantive session of the conference, I would like to introduce Dr. Emma McKinney, who will moderate our first session. So our first session we have one speaker that is available in person, and the second speaker will join us online. So may I invite Dr. Laura Buffoni, if you could come and take a seat here in front, and Dr. McKinney, if you're online, if you're with us online, yes, thank you. Please go ahead. Thank you.
Wonderful. Okay, very excited to be part of the conference remotely and to make it work. So I would like to introduce Laura Buffoni to you. She's a graduate summa cum laude in political science, international economics at the University of Genoa in Italy. She's a doctoral degree in sociology of development from the University of Pisa. And this is where she's conducted a qualitative research in Italy, the UK and Sudan for a final thesis which was focusing on poverty and globalization. She's a published author. After several years of social work and research, Laura moved into the international career space, where she's worked with the UNHCR, the ILO, UNICEF, as well as the Italian government aid agency, as well as consult with several NGOs as well. With UNHCR, Laura has worked in community-based protection, livelihoods and economic inclusion in Ethiopia, as well as Yemen, Senegal, as West Africa, Sudan, Jordan, and Kenya, East Africa, and she's currently in Southern Africa. Her areas of focus are protection of refugees and community-based action, protection from gender-based violence, gender mainstreaming, and child protection, as well as social and gender norms that affect participation, as well as create inequalities. So Laura is going to be our first speaker, and her topic is entitled An Introduction on the Status of Migrants, Refugees, and internally displaced persons with disabilities in Africa. Okay, so she's got 15 minutes to do her presentation, and after which we'll move on to the next speaker. So please keep your conversation, your questions for later. And those of us who are online, you can pop those into the chat, and people who are in present can raise their hands, and we'll have a few questions afterwards. Just for those of us who are attending remotely, please can we ask that you keep yourselves muted, and you can have your camera on if you want to, but just most importantly, keep muted unless you've got a question, which you can also raise your electronic hand later as well. Thank you, and over to you, Laura.
Sorry, this is Ricardo speaking. I think there was a misunderstanding. I was speaking first, right? Laura is going to...
Oh, thank you. That's what I thought. I thought it had been swapped, but the presenter before has just said that she was going first. Okay, well then, it's all about being flexible, not a problem. That was what I was expecting, but that's a problem. No problem. Okay, so then over to you, Ricardo. And Ricardo Cordero works as a protection officer in the Division of International Protection, also at the UNHCR. And this is where he provides technical support on the rights of persons with disabilities, as well as older persons under the UNHCR mandate, which also includes refugees, asylum seekers, returnees, and internally displaced and persons in situation of statelessness, which is going to be a really important area to unpack today. As a development and humanitarian worker, Ricardo has experience in the design, the implementation, and monitoring of human rights programming, and in the development of policy and guidance on the rights of persons with disabilities, as well as older persons in situations of conflict and disasters. Okay, so Ricardo's topic is that he's going to be talking about today are disability inclusion practices by the UNHCR, global and African context. Over to you, Ricardo. Look forward to your presentation.
Thank you, Emma. And just to clarify, this is Ricardo speaking. My sign is an R, a tall R for the interpreter. And my name is Ricardo. So the reason why I'm speaking first is because I'm working at a global level in Geneva, and I was asked to set the scene in terms of disability and forced displacement. And then I will hand over to our colleague, Laura, who will cover more evidence and examples from the region. I'm going to share my screen. I hope that it works. Just if someone can give me that can confirm. Yes, okay, now I see. Okay, so the slide represents silhouettes of persons with diverse genders, ages, and as well disabilities. And well, just the title of the conference. We will do a very brief introduction just to set the scene. And I would like to start with a very small mention to the mandate of UNHCR. We have now in the screen some of the hundreds of UNHCR tents that were delivered to the transit camp being built by authorities and NGOs are at Garmawa. So and then an extract of the explanation of UNHCR's mandate, reading, acting under the authority of the General Assembly, UNHCR shall assume the function of providing international protection and of seeking permanent solutions for the problem of refugees. Originally, the core mandate of UNHCR covered only refugees, and that is persons outside of their country of origin for reasons of feared persecution, conflict, generalized violence, or other circumstances that have seriously disturbed public order, and who, as a result, require international protection. However, over the time, UNHCR's mandate has as well been expanded to cover returnees, so people who are returning their homes after being forcibly displaced, and stateless persons, so people who do not have a recognized nationality by any country of the world, and therefore have a deprivation of access to civil rights and political rights. Although UNHCR have no general mandate for internally displaced people, UNHCR may be involved in certain circumstances to enhance protection and provide humanitarian assistance to this population. And finally, UNHCR collaborates as well with governments and other international organizations in the response to mixed movements, situations where a number of people are traveling together, generally in a irregular manner, using the same routes and means of transport, but for different reasons. People traveling as part of mixed movements have varying needs and profiles and may include asylum seekers, refugees, stateless persons, victims of trafficking, unaccompanied or separated children, and migrants in an irregular situation. Due to the complexity of these type of situations, the management requires the collaboration of multiple stakeholders, including as well UNHCR. This just to set the scene and help as well to differentiate some of the situations that different profiles and different people would face. Now, changing the slide, we wanted to give as well to help setting the scene a bit more of detail on the policy framework that has been as well mentioned in the opening remarks by Professor Viljoen. The slide represents in the center, there's the UNHCR policy on age, gender, and diversity, and on the left and right sides, we have on the left the policy and legal framework that pertains to persons with disabilities, including as well within UNHCR, so from the global level to UNHCR, and on the right side, policy frameworks that deal or support the work with refugees and stateless persons. At the center, and I will be describing a little bit more in detail why we are putting all this in this crowded slide, there are regional instruments and then a line on intersection. I'm just describing the slide now. So, of course, what is key and what changed really the perception and the as well the reaction at the legal level on the situation of persons with disabilities was the convention in 2006. The Convention on the Rights of Persons with Disabilities was formally endorsed and acknowledged by UNHCR through an executive committee conclusion in 2010, which was set up to change the approach, the language, the type of responses that UNHCR was providing to refugees with disabilities, and to as well set a level of enforcement that was followed up by other more operational policies, such as the policy on age, gender, and diversity. This policy framework has been strengthened throughout the years through the UN Disability Inclusion Strategy that some of you may have heard, and it applies, it's a UN system-wide strategy with an accountability framework that we have to implement and report against in an annual basis to the Secretary General's office. The overall reporting and responsibilities for UNHCR in the implementation on rights of persons with disabilities is therefore strengthened. We have annual reports, global reporting that is informing our work on age, gender, and diversity, including disability, but then we have a dedicated report that is shared with the Secretary General with 16 indicators across different areas, including programming, but as well employment, accessibility, etc. There is a last as well framework that was recently, in brackets, endorsed as well at the UN system and is the first Security Council resolution on the rights of persons with disabilities in situations of conflict, and is the UN Security Council Resolution 2475, which is in the screen as well. There are, as I mentioned as well, then regional instruments that apply. It was mentioned as well in the keynote, the African Disability Protocol. There's the IDP, the Convention on Persons who are internally displaced as well. And then there are a series of political commitments and instruments that help us to monitor commitments, to ensure more ensure pledges, commitment, direct engagement from member states, academia as well, civil society, bringing everyone together, and that includes the Global Compact on Refugees. Now, what I would like to highlight is that in practice, what happened, for example, in 2019, after the Global Refugee Forum, which was a forum bringing together academia, member states, civil society, UN entities, etc., to advance in the response for refugees, there were 1,400 pledges or commitments made. However, doing an analysis of all those pledges, only 7 were related to disability or focused, and then there was an additional 30 approximately, including somehow disability. This is a first sign on the absence of political commitment at a global level. And that includes as well academia, civil society, etc. The interaction between both needs to be strengthened, between both legal frameworks needs to be strengthened as well. And I will provide some details before, but I would like to give it as well, just to set the scene and an overview in terms of what is the size and the depth of the situation, the issue that we are discussing. The slide represents now an infographic that was developed by the Interagency Standing Committee on the prevalence of disability across the world. 15% is a very well-known figure, and it is then disaggregated by age, gender, as well with women, children, older persons. What is important to note is that there was evidence, but only anecdotal, not sufficient to be reflected in that report that is already more than 10 years old, that situations of forced displacement may have an impact in the prevalence of disability. And now the slide represents on the left and right side reports from Jordan, Syria, and Uganda, which is more relevant for the region, confirming that finding. Jordan had 21% of Syrian refugees with a disability in 2019. Syria, with an open conflict, 27% of persons with disabilities across the population, so a really high prevalence. And in Uganda, there's 17% across the refugee population. What is interesting to know as well, and I invite you to go through these reports, is that the quality of the situations that persons with disabilities, or the information on the situations that persons with disabilities are facing, is becoming more and more informed and nuanced. We have we don't have only prevalence data now. We start to have as well an understanding on access to livelihoods, on limitations in access to health, etc. I won't explore a lot on this because my colleague Lara will go through it, but I would like, passing through the next slide, to highlight some of the protection issues that very specifically to the protection mandate of UNHCR, we have been identifying throughout these years and adding up to what Ms. Biomire has been highlighting. First, invisibility is a real problem, and although we have some really powerful and reliable data in some context, it is not the norm. And then we have very little and anecdotal information on key issues that are related to forced displacement. For example, increased risks in detention. We see that people who cross a border in an irregular way may face deprivation of liberty, and the duration and the severity of the condition that persons with disabilities may face is longer. Lack of interpretation, suspicious behavior perceived by authorities, etc., are some of the causes. There is a huge gap as well in understanding disability and asylum. And this is something where we are exploring through a discussion paper I will mention later, the whole interaction from accessing asylum procedures, accessibility, CRPD provisions, reasonable accommodation, etc. in asylum procedures, on how disabilities as well conceptualized and understood as a potential factor for persecution or contributing to the persecution. And for example, the situation of persons with albinism is a very frequent example, but as well how then refugees with disabilities may have access to protection measures addressed to persons with disabilities in their host country or to refugees with disabilities, and how they may face barriers to access those. Disability is as well the first factor for statelessness at the global level due to a variety of issues, and there's a research paper that was issued last year by UNHCR on this, and this includes barriers in registration, lack of registration of children with disabilities at birth, but as well in the process of naturalization, finding barriers as linguistic tests, oaths that have to be made, that would be limiting the possibilities of persons with disabilities, together as well with all these type of assessments on mental health that may be very, very relevant as well in terms of hampering access. When persons with disabilities then are going to resettle or return or integrate in their countries or host countries, in what we call durable solutions, there are additional support needs. There are barriers, there's discrimination that intersects with disability, and this includes as well digital barriers. The progressive digitalization of humanitarian assistance, protection, etc., is leaving behind many people with low digital skills or with facing barriers to access to the internet or to mobile devices. This has been, for example, reflected in research, and the slide represents now 4 different documents. We have UNHCR's approach to disability or forcibly displaced and stateless persons with disabilities, which explores the annual priorities that UNHCR has The second one is a research on bridging the mobile disability gap in refugee settings, and it has been one of the priorities in the last years, demonstrating first with evidence that refugees have less access due to administrative barriers, financial barriers or restrictions to the internet, to mobile devices, etc. And within that population, refugees with disabilities even less, and there's evidence from different African countries and contexts in this regard. And then as well documenting good practices on how these barriers can be addressed. All these processes are informed by our UN Disability Inclusion Strategy and an action plan that was developed to advance on it. But trying to be brief as well, not wanting to take more of your time, it has been mentioned by Ms. Biomiri as well, how the collaboration and the meaningful participation of persons with disabilities is key. UNHCR acknowledged that gap formally in several times, and in particular in the Global Refugee Forum, and the International Disability Alliance, which is an umbrella network representing persons with disabilities, giving time for the interpreters. So the International Disability Alliance, and the screen represents a picture with both logos, had as well expressed an interest in bringing up voices of refugees, stateless persons with disabilities, acknowledging how the disability movement has not been very representative of those groups facing intersecting barriers. So we developed an agreement and a global partnership that has then have an impact at the national level, and as we will see in regional level, for strengthen mutual capacity building. So organizations of persons with disabilities training UNHCR staff on disability rights, and in that exchange, learning about forced displacement. This happened this year, for example, in the Democratic Republic of Congo, thanks to the support of our colleague Laura in the room. There is as well an issue in accessing humanitarian coordination, as mentioned by Ms. Biomire. Decisions that are taken without persons with disabilities will leave behind many of their requirements, and we are working to include organizations of persons with disabilities through age and disability working groups, for example, into protection clusters and into another working groups and clusters or interagency coordination, as well at the global level, for example, in the Global Refugee Forum. Human rights monitoring, many people is not aware that UNHCR as a UN entity has as well a capacity and a responsibility to monitor the implementation of the Convention on the Rights of Persons with Disabilities. We develop confidential reports and share them with the Committee on the Rights of Persons with Disabilities. And through this work, we collaborate with organizations of persons with disabilities who develop shadow reports to inform their report as well and to exchange views in the developing of those submissions. And finally, supporting our own organization in the implementation of the disability inclusion strategy. I won't expand a lot there, but just mentioning, for example, by conducting accessibility audits to premises, to digital spaces, etc. That is part of our work. We'll stop here not to take more time and hand over to my colleague, Laura, in the room. Laura, over to you. Thank you.
And thank you. While we're waiting for Laura to do the next presentation, just thank you so much for your presentation, just showing us the different work that has been done, the exciting projects, the interventions, the policies, the documentations that you have developed, and also the importance of working with people with disabilities and saying what is going to work, what's going to work best for you, and involving organizations that are supporting, representing people with disabilities is vital. So thank you so much for that. And over to Laura. Thank you.
Emma, I hope you can, yeah, it's all good. Good morning again. My name is Laura Buffoni. Emma, you don't need to repeat my bio. It only makes me feel older. So I will go ahead with my introduction. I'm a bit rusty as an academic, so to be here is both a big honor, but also a bit intimidating because I know I'm surrounded by academics. I would rather define me something in between a practitioner, but not a specialist. So I will just give you a few notes on forced displacement in the region that for the UN Refugee Agency where I work, I oversee. So it is all Southern Africa. We call this region for us administratively, it's all countries from DRC southwards. So from the big DRC to Zambia, Zimbabwe, Malawi, Mozambique, up to South Africa and the island states. We should have the slides back.
It's Ricardo, yes, I'm still sharing the screen.
Ricardo, are the slides with you? But it doesn't matter. What I was going to say about the Southern Africa region, we have a very specific pattern of displacement. In fact, when I read to you the figures, we see that there's over 7 million internally displaced. And this is, of course, a figure much influenced by the Democratic Republic of Congo that, as you know, as we speak, is still experiencing active conflict. So the issue of internal displacement and the figure is much influenced by the DRC. I think we can say 6 million are definitely in the DRC. And then we have over 1 million refugees. One doesn't always think about Southern Africa and especially South Africa as a country hosting refugees, but in fact also South Africa is a country hosting refugees. Ricardo gave us a bit what we know about persons with disabilities in our populations. And I was going to mention for Southern Africa, what we were able to capture is only around 7,000 people in our registered population. So we registered refugees. We are unable to register internally displaced because, as explained, they're within the country. So it's the government's responsibility to know who they are, mostly. For refugees, UNHCR support is much stronger in the registration, but nonetheless, the percentage of persons with disability we are able to capture during the registration of refugees is minimal. Next slide. So I want to be honest and with you. As a UN agency, we still have gaps in identifying persons with disability. We're happy to be here with the academia, with the practitioners. We also have a lot of gaps in advocating because, as you heard from Ricardo, our protocols, conventions are there, but we need still to create those partnerships. With IDA, we have started on a very good setting, but advocacy still has to be in our plans, in our humanitarian responses. And unfortunately, in a very resource-stretched world, we tend to forget that we need to advocate for the most at risk, the ones at heightened risk. We spoke about partnership. There's a lot as UN staff we still have to learn. And hence again, the partnership with IDA, we we like to develop the partnership with other actors like all of you in the room. And we really need to absorb and be able to use that language of diversity. So I myself, I know I made already a few mistakes as I'm speaking. I have not described the photographs, but I will try to describe this one. I think, and I'm sorry, unlike Goretti, I don't have a real life story ready for you, although we would have many. But I think it was extremely interesting to see how one story will remain with us. So in the photo, you see just a regular camp setting in a refugee situation that could be in any country in Southern Africa. You see the quality of accommodation, the huts are very basic, the rugged terrain. So mobility, communication, these are all issues that living in a refugee setting makes extremely difficult. Next slide. So having admitted our gaps, I just want to mention a few things we do. I will not say the volume of things we do, but the type of things we do. We continue to try to address the basics, the assistive devices. UNHCR, like many humanitarian actors, is moving progressively towards cash transfers for delivering humanitarian assistance. And I think that's an excellent tool not to make mistakes in the type of support we provide. So cash allows the beneficiaries to access what they need most. But as I said, a lot of in-kind support still exists. With persons with albinism, our support is again minimal. We invest quite a lot in sensitization and training. And to address the issues of registration, we have started using the Washington group questions when we register or we verify refugees we work with. And then there are some spot interventions. We have in Malawi a care center for children. As Ricardo mentioned, we had some targeted learning in the DRC. And we will go now to look at one example in a country very near to South Africa. Next slide. So I just wanted to give you one example. We have a big crisis in Mozambique. As you know, there is over 1 million displaced people in the northern region of Mozambique called Cabo Delgado. Villages destroyed, terrorist attacks, widespread human rights abuses, families being separated, a really, really dire human rights and humanitarian situation. In the photo, you see an older man and a younger displaced person, both with disabilities. And again, if we can imagine the situation in Cabo Delgado and the human rights abuses, the difficulties, the forced displacement, the loss, we can imagine the intersectionality of having a disability. Next slide. While we, as I said, admitted to a lot of gaps in being able to identify, we have been estimating that in Cabo Delgado, at least 50% of the population has what we call in our jargon a heightened protection risk, and that 29% again could have a disability in this population of over 1 million of displaced persons. So just make the math. I'm not good at it. I'm a qualitative researcher. 29% of the displaced in Mozambique could possibly have a disability. And in the photo, we see one of our colleagues in UNHCR trying to support a lady in a wheelchair to access her entitlement of assistance. Next slide. So just to say, we found in Mozambique that working with a local organization, a small organization called FAMUD, that some of you might know, has been very useful. It is a drop in the ocean. It's a small pilot project, but I think they really helped us in identifying persons with disabilities, in training us and the community, in distributing assistive devices, because they definitely did it better than what we would have done by ourselves, and especially working on youth. Youth being another important work we do in Cabo Delgado, there was that element of inclusion that we needed to have to really ensure protection of youth with disabilities. So just to finish, this was a small example from Cabo Delgado. I cannot say more that we still have a lot of challenges. We're still very, very far from perfect. We don't have specialists in UNHCR, and I would say in the UN in general. There is very few, Ricardo being one of them. But as I said, I'm a generalist. Most of my field colleagues are generalist social workers or community workers. We do, in spite of the big narrative about localization of humanitarian action, we do find it very difficult to sponsor, to fund local organizations who have the best knowledge of the field. We lack coordination. Yes, we need to talk more amongst ourselves, as we're doing now. And definitely a big area of, I would say almost a void when it comes to persons with disability is the whole area of mental health and psychosocial support. So these are the challenges we identified in our daily work with refugees, displaced, stateless person. I'm happy to stay with you a few more hours. And if we have the opportunity to interact and for questions, I will happy to try to answer them. Thank you very much.
Wonderful. Thank you so much for your presentation. Really appreciate getting different views and yeah, just your amazing work that you are doing. And as one qualitative researcher to another, the stories and the experiences are as important as the numbers. So thank you for that. And also, a lot of us are so worried that we're not making a big enough impact, and we still trying to work which way is up. But this is why this type of platform is so important. It's about building partnerships, showing what is working, what isn't working, how we need to collaborate, and yeah, just sharing stories and what work is being done. So thank you. I know we often work in silos, so that this is a wonderful opportunity to share the good work that is happening. And again, same as what your colleague was saying earlier, the importance of collaborating with organizations and people with disabilities as well. And yeah, your numbers were a little scary, just in talking about the forced displacement of over 1 million persons and over 1 million refugees. Yeah, and the DRC situation is just really worrying. But rather than just throwing up our hands. We need to be looking at what creative solutions can we come up with, who can partner, who can add value to coming up with solutions that are relevant to the different contexts. So thank you both very much for your presentations. Yeah, and just talking about advocating for those who are experiencing so many challenges, and giving voice to their experiences, but also, as you said, advocating on their behalf as well. Your case study was really wonderful as well. And to be able to identify challenges is important, but also coming up with creative solutions. So it's going to be quite difficult for me from sitting remotely, but perhaps someone, are there questions in the audience? If there are questions, please could you raise your hand? Can you just let me know? The same online, if you want to pop some questions in the chat, or just raise your electronic hand or switch your camera on, that would be wonderful. So please use this opportunity to ask questions. These are wonderful people who are going to give you great input. Thank you. Sorry, is there anyone who's actually at the venue is able to answer, to field any questions for us? Thank you.
Anybody breaking the ice with a question?
Be brave.
Good morning, everybody. My name is Mahasi. I hope you can hear me. I'm a disabled woman. I live in Cape Town. So a question to you, ma'am. Is there a way to get, funny enough, you should speak about Mozambique. I was sitting at breakfast with a lady from Mozambique and I said to her, give me the statistics of disabled people in Mozambique. And she said, I don't know. So we need to find a way to track disabled people in Africa. I know, for instance, that in South Africa, Google says there's 3-point-something million disabled women alone. And I could tell you the percentage of disabled people in America, but I can't tell you about the people in Africa. And it's very unfortunate because we're also the poorest continent. So thank you for being here. I need us to find a way to connect each other throughout, and we need to find the stats, because it's because of COVID as well. This is something that's going to be ongoing. People are only realizing how damaging this virus has been. So if there's a way to start a conversation about how to get a tracking mechanism of some sort for disabled people all over Africa, I would appreciate it. Thank you.
Great. Ricardo or Laura, would you like to respond? Thank you.
If I can share, this is Ricardo speaking. It's a very relevant point. The use of the Washington Group questions, as mentioned by Laura, are key. UNHCR is promoting them, using them in registration more and more. They are part of our registration system now. However, the discussion is more complex as well than what it may look like, because one issue or one thing is identifying the demographic data that gives you statistics. Those reports that I mentioned from Uganda, etc., use the Washington Group questions. You have qualitative data that you can then triangulate with quantitative data, but a different issue is disability determination and certification that gives actual numbers that usually countries report. So you have census data where the Washington Group questions, you can advocate for include those, etc. But then the numbers of persons who are receiving protection services, children who are receiving protection services, those numbers come from other type of approaches that are very complex and not inclusive for refugees, because they are designed for national population. So that is a very complex ball. Just the last key point is that we need data, but data shouldn't prevent action. Accessibility, planning for reasonable accommodation can be done in the absence of data. A building is accessible not because you verified that someone is in the population and needs to access it. It's just because there are standards that you need to follow. That is something that we need as well to advocate for.
Thank you very much for that, Juran.
Wonderful. Thanks, Ricardo. And yeah, exactly what you're saying. Statistics are important in terms of planning, and yeah, that's great. But what do you do with that data moving forward? I see we've got a question from Kristen Dunkel. Would you like to unmute and ask your question? Thanks, Kristen.
Sure, thanks. Kristen Dunkel, Chief Specialist Scientist at the South African Medical Research Council, for those who don't know me. Just on this measurement question, I've participated in a lot of debates recently about the limitations of the Washington Group questions, and in particular, the Washington Group short set. And as a person with a disability who isn't picked up by that and who is aware that they miss out on actually a huge number of people who do require accommodations, I'm a little bit curious as to whether this forum wants to be advocating for that set of questions versus another set of questions. And in particular, I'd like to hear from UNHCR why you favor the Washington Group short set versus, say, the HUDOS or the new 11 question short set of questions that's emerging from WHO and in press. Thanks.
Thank you. If I may answer as well to this one. It is a very important debate. The way in which UNHCR has positioned the agency is selecting from the, so including the 6 questions, but adding additional questions to better access psychosocial disabilities or identify factors that can be proxy indicators for psychosocial disability. So the number of questions that are available now are 8, and those are doubled because there's for children as well. So we included as well from the UNICEF short set. In terms of the why, well, there is a question of timing. The HUDOS requires a lot of more time. I won't qualify the time, but just quantify, requires more time. Registration has many times a really limited time, and then acknowledging that it's not a one-off issue. So the idea of collecting data or using the Washington Group questions, at least for UNHCR, is just to raise a red flag on further protection needs and the need for further assessment. Is we don't certify disability, we don't provide, based on that identification, automatically support, and support can be identified through an interview. Other support needs when they are referred to case management. So if the person, regardless of those questions not being capturing disability, states that there are difficulties, still that would trigger, and there is an option of just marking disability without one of the questions and supporting in case management, of course, when time allows, and that is what the main issue.
Thank you so much, Ricardo. I believe we've got a question from the conference room. Thank you.
Oh. Okay, I'm not sure if it's, okay, there we are. Thank you so much. My name is Maluka Ann Miti-Drummond. I am the UN independent expert on the enjoyment of rights by persons with albinism. And I recently did a report on persons with albinism on the move, which UNHCR are aware of. But I wanted to firstly thank you for your support in relation to that. UNHCR was very supportive in providing information and just meeting with me and responding as well to my call for inputs around that. So I wanted to first start by thanking you on that. And then my questions, I've got 2 questions, and one is very closely related to the question that has just come before around information, disaggregated information around disability as well. Just as the previous speaker said, like there are questions around the provisions of specific support for different groups of people depending on the disability. For example, obviously around albinism, we talk about the access to sunscreen for persons with albinism who are in refugee settlements. And also just understanding what is the percentage of people with disabilities in camps, refugee camps, settlement camps, who have different types of disability, which I think would be useful for all of us, depending on which areas we work on. So just what is the possibility of getting that and more access to disaggregated data on the type of disability. And then another thing that I would be interested in as well is issues around refugee status determination. and the grounds for refugee status determination, if within the African context, this has been expanded to include people with disabilities broadly, if persecution due to your disability or, I don't know, stigma discrimination, extreme stigma and discrimination based on the disability is now being recognized more in refugee status determination as a ground for granting refugee status. It's an area where I think it's very hard for us to get information specifically on the reasons people are given refugee status and whether this is now a recognized ground, particularly in the African context. Thank you.
Ricardo, would you like me to take that?
If you want, and
with some
yes,
limited answers. So
yes,
thank
go,
you so
please.
much thank you so much for your questions, and thank you so much for your work. We go back to the data issue. I depicted a bit of a dramatic picture. I think it's case by case, depending on the type of registration we have to support the government with. So there are longer and shorter forms of registration, depending on how much the host government takes on. In some countries, and in Southern Africa, we have a good practice. We have an MOU for including all refugees in the national census, and that will help to have more granular data on the different types of disability. But totally agree with you, we're not as bad everywhere. It depends on the agreement we have with governments. It depends how much we do the registration ourselves as UNHCR. On refugee status determination, that's an extremely good point. I personally, in this region, did not come across a debate or a case of a person with disability experiencing stigma and discrimination in his or her country of origin. So unfortunately, I have to hand over to Ricardo whether in other parts of the world this is seen, because surely it needs to be happening, but I'm not sure that it is seen. And as I said, I admit I have not come across in this region. Over to you, Ricardo.
Thank you, and nice to be in contact again with the independent expert. There is a growing number when those are shared, and that is the problem again, the invisibility on numbers. But there is a debate that we have started as well with the Special Rapporteur on the Rights of Persons with Disabilities, the CRPD committee, with the support of the International Disability Alliance, on the issue of refugee status determination, but overall the interaction between refugee law and the Convention on the Rights of Persons with Disabilities and other instruments relevant for persons with disabilities. And there is clearly a gap. Cases include, for example, persons with albinism who are supporting or asking for asylum in Thailand, for example, and giving some anonymized cases that we work together with the independent expert, and who were facing persecution in country, and again, in all transparency, our own staff not being fully aware of what is the role of albinism into the claim, right? That is a gap. There's no dedicated guidance. For example, there are guidance on international protection that UNHCR has been developing in coordination with other states, and other stakeholders to support the implementation of refugee law. And there's not sufficient guidance for our own staff and for countries working on asylum procedures to inform those cases. And that gap is being informed by a paper that we will be issuing probably by the end of the year, and hoping to continue that work in the future. It will take time, but there are cases. Mental health, for example, when the behavior of the person may be considered as blasphemy because it's not in line due to psychosocial disabilities, intellectual disabilities, to social norms, sometimes religious norms prevalent in an area, and that's potentially amounting to persecution. That debate needs further exploration, and there are only anecdotal cases that do not get very visible as well for protection issues and stigma. Over.
Wonderful. I'd like to thank both speakers. I know we're running out of time now, but thank you so much for sharing your experiences, the work that you're doing, the important work, the need for future collaborations and partnerships is wonderful to hear. So thank you both. I know that there will be conversations during teas and lunches as well, but for those of us who are not present, please continue to pop questions into the chat box or even individual direct messaging as well. Yeah, so I'd like to move on to section B of our day, and we're going to be looking at the impact of climate change on migration and displacement. But yeah, I'd like to say a big thank you to our two previous speakers. Keep the dialogue, keep the conversations going. Thank you.
And Emma, just to add, the dialogue will definitely be kept with the Center for Human Rights as our bureau. The UNHCR bureau here in Southern Africa is going to sign a memorandum of understanding next week with the University of Pretoria Center for Human Rights. So we're very happy to continue that conversation. We have made sure that issues of disability inclusions are mentioned in the MOU. So definitely we'll talk more.
Okay, thank you, everyone. So we are about 5 minutes away from the tea break. So this is what I propose, since we are running behind time. I propose that I dispense with introducing our speakers just before we take a health break. Then immediately after the health break, then the speakers just go ahead into their presentations. I hope that's all right with you. It shouldn't take me too long. There is a slight change to our program, which I must alert everyone to. So the second session, session B, on the impact of climate change on migration and displacement, was supposed to be moderated by Ms. Mary Alma-Dinimoy. However, due to a personal emergency that she had, she's unable to moderate the session. So I will be doing that for her. So just to introduce to you each of our speakers before we take a break. So I will read out their bios. The first presentation that we will have is titled The Intersection of Internal Displacement and Disability, a critical analysis of laws, policies, and emergency response to flooding in Ghana. The presentation was jointly prepared by two people, Oberon Jalil Odum, who is the National Coordinator in Ghana of Inclusion Africa, as well as Brian Atinga, who is the Inclusion Interventions Manager in Ghana, again, for the organization Inclusion Africa. So just their bios, beginning with Jalil, who will be presenting on behalf of both himself and Brian. So Jalil is a holder of 2 master's degrees, one from the University of Pretoria in disability rights with distinction, and the other from the University of Development Studies in Organization Development with whole system transformation as a major. He currently serves on the boards of the African Disability Forum, Africa Platform for Social Protection, Africa Dementia Support Services, Special Olympics Ghana, and the Autism Society of West Africa. At Inclusion Africa, Jalil is the chairperson of the board of directors and represents Africa on the Council of Inclusion International. He has been working in the last 12 years at Inclusion Ghana, and this is the PEAK network organization advocating for the rights and needs of persons with intellectual and developmental disabilities and their families in Ghana. And he's been working as a national coordinator within that organization. Jalil is a strong advocate of the rights of persons with disabilities at the country, regional, and global levels. He is a core member of the Civil Society Coordination Mechanism for the Conference of State Parties at the United Nations, and also a member of Africa's Regional Response Team on the Catalyst for Inclusive Education Initiative by Inclusion International. His colleague who prepared the presentation together with him is named Brian Sobono Antinga. So Brian holds a bachelor's degree in sociology and social work from Kwame Nkrumah University of Science and Technology in Kumasi, Ghana. He also holds a Master of Science degree in development management from the University of Agda in pronunciation, Kristiansand, I don't know, Norway. Mr. Antinga is currently a PhD candidate in development studies at the School for Development Studies, University of Cape Coast in Ghana. His doctoral research focuses on the right to health of persons with intellectual disabilities in Ghana, with a specific focus on exploring knowledge of sexuality and reproductive health, and more importantly, access to sexual and reproductive health services by persons with intellectual disabilities in the greater Accra region of Ghana. Please do let me know if I'm going too fast. For the sake of the interpreters, I will slow down just a little bit. My apologies. The second presentation in this session, again, there's been it's by Esther Karanja, and her presentation will be on conservation of forests and displacement of indigenous persons with disabilities in Kenya. So Kenya's, Esther's bio reads as follows. Kenya is an advocate, Esther is an advocate of the High Court of Kenya with 6 years of experience in public interest litigation, legal research, and human rights advocacy in the fields of refugee rights, disability rights, women's rights, and access to justice. She holds an LLM from Kampala International University in Uganda and a postgraduate diploma from Kenya School of Law. Esther works for the judiciary as a legal researcher attached to the Honorable Judge of the Environment and Land Court. Her work centers on conducting in-depth research for the judge on environmental and land law. She studies and researches on precedents from the national courts and Commonwealth countries to create and grow jurisprudence in the areas of land law, environmental law, climate change, ancestral land rights, as well as community land rights. She is inspired by nature and good food, which is abundant in her beautiful coastal town of Mombasa. Whenever she's not poking the law for public good, she crochets and she cooks a delicious meal or simply rests. The third presentation in the session is as a change to the program. It was supposed to be George Piri and Macpherson Jere, who unfortunately were also not able to make it for the presentation. So in their stead, we will have a presentation by Dr. Emma McKinney, who's just moderated the previous session. And this is, I will read out Dr. McKinney's bio. Dr. Emma McKinney is a senior research officer at the University of Cape Town's Perinatal Mental Health Project, supporting the integration of quality maternal mental health care to optimize access to health, development, and to social justice for pregnant and postpartum women. She's an experienced lecturer and teacher of children with disabilities who is passionate about inclusive education. Emma has conducted numerous disability country and program reviews in Madagascar, Malawi, Zimbabwe, Zambia, Ethiopia, Namibia, Tanzania, and South Africa for organizations including UNICEF. Most recently, she conducted a study on the impact of COVID-19 on people with disabilities in South Africa for the UNDP. As a woman with a disability, She understands many of the challenges facing people with disabilities. The final presentation in that session will be from Munashe William Poperi, and his presentation is titled State of the Rights and Protection of Persons with Disabilities in Zimbabwe During and After Cyclone Idai. Munashe is a second-year PhD student in the Global and Area Studies with special emphasis on peace and security in Africa, jointly offered by the University of Leipzig and Addis Ababa University. Munashe is a Zimbabwean national and is researching on the PhD topic, which is the state of rights and the protection of persons with disabilities in Africa, a case study of Zimbabwe under the 2013 Constitution. For his undergraduate studies, Munashe studied a BSc in Peace and Governance with Bindura University of Science Education in Zimbabwe. And for his master's, he studied an MA in Global Studies with special emphasis on peace and security in Africa. Some of the notable achievements by Munashe during his career so far has been being named one of the top 3 finalists on the TANA Forum Africa University's essay competition in the year 2018. In terms of his experience, he has internships with the Institute for Security Studies Africa and the Zimbabwe Prisons and Correctional Services. Munashe William has research interests in issues of disability rights, human rights, peace, and security. So that will be the final session final presentation in that session. So I think I'm trying to buy us some time, having dispensed with the reading of the bios. I would like to propose that we now take a brief health break. We were supposed to take 20 minutes. May I kindly ask that we make it 15, just so we try to catch up with our time, if that's all right. Thank you. So for those of us who are present physically, the tea is just outside this room. Just as you step outside, you'll see it there. For those of you who are online, I'm sorry you cannot partake of the goodies that we have here, but hopefully in your homes and respective offices, you'll be able to maybe make a cup of coffee or something. So hopefully see everyone in 15 minutes. Thank you. Okay, good morning once again. I apologize, it was a very rushed tea break. But I hope that you'll be able to just finish up your teas as we proceed with the program. So I'd like at this stage to ask our first speaker, Oberon Jalil Odum, to give us the first presentation, please. Oberon, are you online? Thank you.
Yes. So good morning. I don't know. Yes, it's not afternoon yet, but for all those joining from different countries, I wish you good morning, good afternoon, and good evening. So our presentation is on the intersection of migration, internal displacement, and disability. We are basically we basically reviewed the laws, the Ghana laws and legal, frameworks that exist. But our sharp focus will be on, the flooding in Ghana. So I'm just going to introduce to you what the situation is in terms of flooding and persons with disability. So we say that persons with disability are amongst the most vulnerable and disproportionately affected groups in migration and internal displacement situations. As you may already know, disasters like flooding can actually worsen the social inequalities around health and housing for persons with disability. And if you compare persons with disabilities and other groupings, you see that they are mostly affected profoundly. Just to indicate a research that was led by the University of Sydney Center for Rural Health, it shows, for example, that when you compare, persons with disabilities and their carers to others, they are more likely to have their homes flooded and be evacuated. They can still be displaced even 6 months on. They experience disrupted access to food support services, as well as essentials such as healthcare and social services. They can also continue to be in distress even 6 months after the flood has happened. They can also relatively have high risk of post-traumatic stress disorders, even 6 months after flooding has occurred. And you would agree with me that floods can have really enduring psychological impacts. For people with disability, they can actually have prolonged distress and post-traumatic risk disorders. And it's usually higher in them than other population. Too often, persons with disabilities are not adequately included in community-level disaster preparedness. And looking at some numbers, if we look at the UNHCR numbers, there's an estimated 12 million people globally who are internally displaced, who are persons with disabilities, according to the 2020 estimates. Ghana has actually experienced many floods in recent years. Very typical example is the 2019 flood in the Upper East region, as well as in the Ashanti regions, as well as the northern regions. And when you look at this flood, and generally you look at persons with disabilities, then your guess is as good as mine. Talking about people who are blind, people who have intellectual disability, people who have, mental disabilities, you can see that this flood will be very, very catastrophic for them. And so we want to see what the legal frameworks look like. But before then, let's look at some data issues. So in terms of data, we don't have official data on persons with disabilities when it comes to internally displaced population. And this is a real challenge. Even where data exists, it's actually not disaggregated and not collected using standardized tools for comparing, different population, such as persons with disability. So in terms of the knowledge that we know about intersection of migration, it's quite limited. Migration, internal displacement, and disability is quite limited, particularly in developing contexts such as ours in Ghana. Now, in terms of internal displacement and migration, we all know, what brings it. It includes conflict, violence, persecution, human rights violation, climate change effects. But like I mentioned, we are looking at flooding in this particular instance. If you look at the UNDP estimates in 2022, over the past 10 years, they give a cumulative estimate of 162,299 persons who are internally displaced in Ghana. And they attribute this to climate-related disasters, normally the storms and floods. And again, like I mentioned, this data is not disaggregated to reflect disability in any way, and particularly the context of internally displaced persons. Nonetheless, there are national, regional, global frameworks on migration, internal displacement, and they provide different guarantees at different levels and protection for internal migrants and displaced population. So we are looking at the legal and policy framework in Ghana and the extent to which disability inclusion, actually happens. So the next slides are just going to give us an idea of what exists. Let me look at migration, as the first issue. For migration, we have a lot of legal framework. We have the Constitution of Ghana, the Citizenship Act, the Ghana Immigration Amendment Act, the Human Trafficking Act, the Refugee Law, the Labor Act, and the Representation of the People's Amendment Act. And these are all very important legal frameworks that exist on migration. Although there's plurality of laws on migration, there still remains gap when you look at even our constitution. Even though it addresses, the issue of, movement, where in Article 21(1)(g), it provides for freedom of movement for citizens within and outside Ghana. Other relevant constitutional provisions are also include equality and non-discrimination. You still see there's gap when it comes to internal displacement issues. We don't have, any provision for those who are internally displaced. Then when you look at our Persons with Disability Act, which actually was adopted even, the same year when the Convention on the Rights of Persons with Disability was also adopted, but it preceded, the Convention on the Persons with Disability, the CRPD. And in this particular act, it provides significant protection of human rights and freedoms, such as, right to life, which is very crucial when you think about flooding, equality and non-discrimination, education and health. These are very important, support services that one needs when you go through internal displacement. Again, in terms of policy framework, we have the National Migration Policy and also the Ghana National Climate Change Policy of 2013. And if you look at the migration policy, it has an object to assess the migration environment and climate change nexus and its resulting impacts on especially vulnerable groups, including persons with disabilities. However, disability inclusion still remains a challenge in there. The guiding principles of the policy is silent actually on the CRPD and its protection for migrants and internally displaced persons. Also, none of the proposed strategies to manage migration and displacement, focus on any capacity building for vulnerable groups, including persons with disability, especially when it comes to managing disasters. The same policy as in the migration policy highlights the unique vulnerabilities of migrant and internally displaced, persons with disabilities. It gives some strategies, but basically it fails to recognize disaggregated data as one key, thing to effective migration and internal displacement management. Again, the Ghana's climate change policy of 2013 also highlights policy teams and strategies to address climate change in Ghana. However, considering the unique vulnerabilities of persons with disability, there will be a need for additional strategies to address disability-specific, issues. Like I mentioned, there's no standalone legal framework that addresses internal displacement, even though you find some pieces of information that suggest, in the Constitution that they are providing for internal displacement. Like if you look at Article 21(1)(g), which provides for freedom of movement, it is interpreted to apply to situations of internal displacement, and then provisions of equality and non-discrimination in Article 17(1) and 2 of the Ghana's Constitution also arguably applies to internally displaced persons. Now, specific to internal displacement, we would look at the national disaster management. Anytime you think about flooding, you think about disaster management. So again, in this particular act, there is, well noted. So there is also, it defines disaster and it makes sure that in terms of floods, for instance, it has some provision, or it defines what disaster is in that particular act, and this includes floods. But this particular act is very silent on human rights protection for persons with disability in the context of internal displacement. So moving forward, you will notice that there are various legal, regional and global instruments like the UN Guiding Principles on Internal Displacement, the Kampala Convention, the African Charter on Human and People's Rights, the Migration Policy Framework for Africa, and Plan of Action. And these are all instruments that are so important to, when it comes to internal displacement. But Ghana, for instance, has not ratified the Kampala Convention, which means that it won't have any domesticated, law yet, on internal displacement issues. So however, Ghana recognized the UN Guiding Principles as an important international framework, and it has incorporated that in some of its domestic laws. Again, Ghana has signed and adopted the African Charter on Human and People's Rights, as well as the migration policy framework for Africa and plan of action. And this means that it believes, in issues of migration, but to the extent possible, there is still some gaps in the law regarding internal displacement. So in trying to wrap up this conversation, the bottom line is that there's silence on the intersection between migration and disability, as well as internal displacement and disability. And it is very important that there are strategies made to mainstream disability into migration or internal displacement response programs. And so in conclusion, we say change is urgently needed. Here are 4 things that we propose: that we work with peak and local disability advocacy organizations to make sure that, inputs are made into some of these laws and policies regarding disability. We also ensure continuity of support and services and make sure that there's no disruption to support networks. In times of, disaster like flood, persons with disabilities can be isolated, and so they need access to high quality personal care, transport, food, and other services. We also need to make long-term investments into mental health care and well-being. We also need to develop person-centered preparedness plans. And with all of these, it will be very important that Ghana goes ahead to ratify some of these instruments at the regional level that it has not, and also domesticate it. And we believe that the shortcomings that have been identified in the frameworks on migration and internal displacement raises questions regarding the level and effectiveness of participation of vulnerable groups, and as well as civil society in migration and internal displacement management. And the inadequacy of this disability consideration suggests that we need to amend the provisions of even our migration policy, as well as our national climate change policy, whilst we also look into legislating on same. On this note, I want to thank you very much.
Thank you very much, Jalil, for that presentation. I would like to ask Esther Karanja to now take the floor and present on conservation of forests and displacement of indigenous persons with disabilities in Kenya. Esther, are you ready?
Good morning.
Good morning, Esther.
I'm happy to be here. My name is Esther Karanja. I'm an advocate of the High Court of Kenya, and I'm also a legal researcher attached to the Environment and Land Court. So my work is basically, as my bio has said it, I support the research work of the judges who are attached to this court. And I will be talking about displacement and indigenous people with disabilities in Kenya. A minute, I share my screen. Okay, so I hope you can see my screen. So I'll start off by talking about indigenous people. So indigenous people in Kenya are protected by Article.
Esther?
Yes.
Sorry to interrupt you, but what we can see on our end is your various documents. So it's like we're seeing your entire folder, and then there's just a small, your presentation is in a small screen.
Okay. Can you see anything?
Can you open your presentation, please, and make it large? And possibly, yeah, Close
I'm
that.
sorry, I had request. Yes, can you see anything?
No, we just see all your files. Yeah. Maybe stop sharing
Oh my.
first, open, and then open the presentation, and then start sharing when your presentation is already open. Let's try that.
Okay. Can you see my screen now?
Yes, now we see it. Thank you.
Okay, Sarah, thank you. Okay, so as I was saying that my work here, the paper I'm presenting is on indigenous people with disabilities, and in Kenya, the people who have disabilities are well known. However, when we come to indigenous people, to be specific, there's a gap. There's no data. So I have no data to present before you on that. But so that is one of the biggest challenges we have with indigenous people. Our constitution, Article 260, provides for indigenous people as among the minorities in Kenya. And they are defined as people who have a hunter-gatherer lifestyle, and they have maintained it over the years. So the people that we have in Kenya are such communities as the Ongiek, as the Sewa, the Watwa, and the Wayu. And roughly they are a figure that is less than 170,000. This figure, I got it from the 2019 census. However, these data, they were included as sub-tribes in major tribes. So it is very hard to know the specific number of people that are indigenous communities in Kenya. And one of the biggest challenges in the census report was that they did not conduct census at night in areas which are designated as forest and national parks. And for your information, the national parks and the forests, which have been gazetted as such, are actually the homes that these indigenous people claim. So it means that if you are any indigenous people who are living in these places that are designated as forests, they were not able to be captured. So that is one of the biggest challenges that we have. Now my paper is more about how does conservation link in with the displacement of people with indigenous people of indigenous communities. The biggest issue is on how the forest policy has been created over the years. As you know, Kenya was colonized by the British, so the British imported their land laws in Kenya. The way the indigenous people were living with community land. The land was owned by everybody and anybody could use at a specific time. So the conservation policy that we accepted in Kenya post-colonial regime, it viewed land that was used by the hunters and gatherers as unoccupied, and it was possibly could be said it is government land, which down the years has come to be converted as reserves and forest land. Now, out of this is how we found indigenous people becoming squatters in their own ancestral land. And when when we talk about them being displaced persons in their own land, it is unfortunate because the government of Kenya, when it is estimating who are the IDPs in Kenya, indigenous people who are living in the forest and have been displaced by the conservation policies, are not included as these IDPs people. So they are actually seen as squatters, and we know under our land law, squatters are illegally on land and are supposed to be evicted. And when those evictions are carried out, it ends up being chronic patterns of human rights violation and at the end of the day, their rights are never adhered to. So when we talk about persons with disabilities and their indigenous communities, they face double discrimination. So they'll face the discrimination as persons with disabilities, and they'll also face discrimination as indigenous people. So when they are classified as such, they end up facing double discrimination, and on top of that, they lose life, they lose their livelihoods, and then they end up having more human rights violation, for example, loss of housing, loss of education, loss of healthcare, and when they are the main characteristics of indigenous people is that their livelihoods depend on their lands. So when they are removed from their lands, they lose their livelihoods, and also they lose their ability to connect to their culture. So from that point, all their human rights are violated. And what happens when how does the government ensure that this systematic human rights violation continues is when the government specifically provides the services that they ought to provide outside their ancestral land. So they will, for example, build a school in a far off area that it means that these indigenous people need to move out of their lands to go and access those services. For example, when it comes to registration of identification cards, they will be done, the information that will be captured on the ID card will read that they belong to a different physical location. So that means even when they are coming back and they are trying to bring up, they come to talk about their lands, they are told, no, but you live in a different kind of land. So there are systematic development which are done specifically to ensure that they do not access land. So what is the solution to this? Our solution, we talk about community-based land tenure, is what will ensure that conservation sits side by side by the rights of persons with disabilities in the indigenous communities. I've spoken about Article 260 of the Constitution, which defines an indigenous community. Article 63 of the Constitution specifically says that land that is occupied by indigenous communities who are hunters and gatherers is actually community land. However, on the same breath, the Forest Conservation Act talks about the same thing, that community forests can be community land, the land that is occupied by indigenous communities. However, it is the same law that comes and says that this is actually a forest land owned by the government. However, when the Community Land Act was being created, it was envisioning an area whereby communities that live as indigenous people can be able to own land as a community and thrive in it. So one of the best decisions we have out there is the African Court held a decision for the Ongiek and said that the Ongiek have a right to the forest as their community land. However, the government has not effected that decision up to today. The National Land Commission, which is given the mandate to manage public land, has done a report on land injustices, and they specifically said that indigenous people have been displaced from their lands because of conservation. However, the report has never been actualized. Last month, actually, the court where I serve entered a judgment and said that the Ongiek who are in Mount Elgon forest should actually be evicted because that is the forest, and human beings cannot live side by side with the conservation. So that was a loss for the community, and I hope in the future we'll be able to be in a situation whereby not only the government but our courts understand that conservation can sit side by side with indigenous people. So what do I conclude and recommend out of my paper? I talk about the right to public participation. The right to public participation has been enshrined in the Constitution, and it is the right to be consulted when they need to move. in case the government wants to move them from areas in terms of development, they ought to give their free, prior, and informed consent. The judiciary is advocating for the use of traditional justice system, especially in communities that embrace them, and these systems do not violate the constitution. So there's also there needs to be a deeper understanding on the intersection between disability and indigenous rights. Then majority of indigenous people organizations are not integrated in the mainstream organization of persons with disabilities. Then in the future, we need to map out persons with disabilities to understand their numbers, where are they, what are the interceptions that they have, and how can they be fully included in the community. And of course, we need more funding where money goes. We have more research, we have the implementation of the Community Land Act is the biggest way that you can be able to achieve land rights and community-based land tenure for persons with disabilities in the indigenous community era. So that is my short presentation. Thank you so much for this opportunity, and I will leave you with this quote that land is sacred, it belongs to the countless numbers who are dead, living, and yet to be born. Asante sana.
Thank you so much, Esther. That was a wonderful presentation. Very detailed, yet brief and concise. So thank you so much for that.
Thank you.
You're welcome. Next, I would like to ask or invite Munashe William Poperi to give us his presentation on the state of the rights and protection of persons with disabilities in Zimbabwe during and after Cyclone Idai. Munashe, you're most welcome. Munashe is present physically with us.
Good morning, everyone.
Morning.
As you have already heard, my name is Munashe William Poperi. I'm a PhD student at the University of Leipzig and Addis Ababa University. I will not go into much detail about my bio. It has been read out. So I'm presenting on the state of the rights and protection of persons with disabilities in Zimbabwe during and after Cyclone Idai. So can you slide? Oh, okay. Somebody's technical.
Can we have it as a slideshow, please, so that he can?
I think it would be better. Yeah, so basically.
So now you can.
Oh, okay.
Yeah, now you
Thank
can. And take yourself with you.
I guess someone is coming to technical assist me. Yeah. While this we'll wait for the technical assistant, maybe I might. Okay, no problem. That's fine. So the presentation is basically focused on Cyclone Idai, which took place in 2019. It affected countries in the southern part of Africa, which we had Zimbabwe, Malawi, and Mozambique. As for Zimbabwe, it affected the 7 districts, which included Chimanimani, Chipinge, Masvingo, some parts of Masvingo and Buhera. So basically, I'll be looking at how persons living with disabilities we affected and how has been the situation during and after the cyclone. So in terms of the methodology of the research, it was a desktop research, qualitative in its nature, whereby I was reviewing a number of reports and policy instruments which had been issued out by different organizations. We have organizations such as UNICEF, UNESCO, Plan International, World Vision, and Oxfam. They have produced several reports regarding issues to do with disability and cyclone during and after Cyclone Idai in Zimbabwe. So these were the major sources of information, and also some media reports, particularly the mainstream paper in Zimbabwe, the Herald. They were the major sources of information. So basically, looking at the background of Cyclone Idai, it had catastrophic effects on the general populace. Existing evidence shows that it killed almost like 1,000 persons in Mozambique, Malawi, and Zimbabwe, and you left a huge trail of internally displaced persons, and you left a huge trail of internally displaced persons, and even destruction of property. Now, when we have such a situation to the general populace, what then about the persons living with disabilities? Because in terms of crisis or natural disasters or disasters in general, persons living with disabilities are among the most vulnerable groups which are affected, amongst girls, children, and women. So with regards to persons with disabilities, some lost life, some lost property, and even they are navigating equipment and instruments. So what is important to note is how then were they being treated, or the challenges which they were facing during the Cyclone Idai. So the findings of my paper, can you slide? The first major finding which I noted was that there was no systematic collection of data for persons with disabilities within the Chimanimani community and some parts of Chipinge. So as reported by the UNICEF, they noted that one of the major challenges which was faced when it comes to accounting for persons with disabilities in Zimbabwe during the time period is that there was no systematic collection of data in terms of how many were affected by the cyclone, how many were injured, the depth of the injuries, and what was being needed for them in terms of resources. So this is a general problem which is not only confined to Zimbabwe. It has been presented earlier on by the previous speakers that in terms of actual data on persons with disabilities in Africa, there is a gap within the collection of data. So both in this case, both from the government side and from even the non-governmental organizations, there was a challenge in the systematic collection of data. There are a few scattered empirical evidence on data which was collected, but it's not sufficed to make a conclusive report or a conclusive argument to present that a certain number of persons living with disabilities were affected in Zimbabwe. So this is the major challenge. I think within the presentation, the notes, there are some links which can support some of the arguments which I'm presenting. Can we move to the next slide? Then there is the issue to do with marginalization of persons with disabilities. There is a media report by the Herald in Zimbabwe, which was dated, let me cross check. It was an article by a journalist by the name Rambio in 2019, which noted that people with disabilities generally were being sidelined, not totally included in most of the activities which were taking place, especially in the recovery process during the post-disaster. So this is a major challenge which was faced in Zimbabwe when it comes to persons with disabilities during Cyclone Idai. They were not fully involved and engaged within, be it the reconstruction policy, process, including them in the planning, the implementation. And then the other challenge which was being faced, can we move to the next slide? Closely related to the issue of marginalization is the issue of the lack of an inclusive approach. When we speak of an inclusive approach to disability, we are speaking of including persons with disabilities at all stages, especially during the recovery process. There is need to have their concerns, to have their views, because the way the ordinary populace viewed the Cyclone Idai is totally different from how persons with disabilities viewed the process. So there was need for an inclusive approach whereby they were being consulted, airing and sharing their concerns and views. Unfortunately, this was not accommodated within the recovery process. I think I'll move to the next. Can you move to the next slide? Next. Yes. So the other problem which was faced during and even after the Cyclone Idai was the shortage of assistive devices. Generally, when you look at the Chimanimani, Chipinge communities, these are rural communities and remote. Most of these communities, they do not have enough resources to assist persons with disabilities. So when the cyclone struck the area, persons with disabilities actually struggled in terms of navigating to safer places, right? This is what during the cyclone. Then even after the cyclone, when there was the construction of buildings, schools, clinics, and even general shops, they failed to accommodate for the needs of persons with disabilities. For instance, we have to have disability-friendly buildings whereby we can, people moving on wheelchairs can access.
We can edit where necessary. And then we'll say now how, I don't know who you are supposed to be.
Oh, okay. I'll continue. Yeah. Even we have challenges with persons with albinism. They required sunscreen lotions, which were not readily available even in the post Cyclone Idai period, because some had lost them during the cyclone. Can we move to the next? So looking at Cyclone Idai, it's a case of we had already persons with disabilities. Then there were new cases recorded of persons with disabilities. This information is based from a survey which was conducted by an organization by the name, pardon me, by the name Hope and Healing International, which noted that there were at least 230 new cases of persons who had developed some form of disability during and after Cyclone Idai. So, as I noted earlier on, these new developments were not taken into consideration in the post-recovery process. So, I think these are some of the findings which I had within the review. So, I think I have some recommendations which I had, which I have for after during the what needs to be done. There is need to for Zimbabwe to align its disaster recovery policies to the UNCRPD Article 11, which speaks of states' commitment to protecting the needs of persons with disabilities. There is need for the Zimbabwean government to also align its current laws with the 2013 Constitution with regards to persons with disabilities. Then this one goes to the non-state actors, the civil societies and the NGOs. There is need for them to step in as an alternative in areas where the government has been failing to cater for the needs and protecting persons with disabilities. With this, thank you.
Thank you so much, Menashe, for your presentation. It was very, very insightful and well researched. So we thank you for sharing your research findings with us. Our final presenter in this session is Dr. Emma McKinney. Dr. McKinney's presentation will not necessarily be in line with the topic that we were discussing earlier, but because of placing, this was the slot that we could find for her. So please do bear with us. Dr. McKinney, please go ahead.
Great, thank you so much. And I'm sorry for gate crashing the wrong party here. Is my presentation full screen, or is it still, can you still see page by page?
Now it's full screen.
Lovely. Okay, so I clearly have got the graveyard shift before lunch. So I'm going to be focusing on the importance of hearing voices and looking at intersections of race, of gender, of culture, language, and disability in the migration process. Yeah, so background, I mean, we've been speaking about it a lot this morning, but we understand that civil unrest, military and other forms of conflict, as well as economic collapse in certain countries, natural disasters, all of these factors and many more have resulted in large number of deaths, as well as resulting in people with acquired disabilities as well. And we do understand that there are some people who are born with disabilities, but these factors are really increasing the number of people with disabilities, especially acquired disabilities, especially in many of our African countries where our focus is today. So we look at disasters. We know that there's a real unequal impact on either the very young, so we've got our vulnerable babies, our pregnant moms, through to the very old. So we understand that those two groups specifically have significant unequal impact. But then also included would be people with disabilities. And again, we're going to look at lots of the intersectionalities, because you get young people with disabilities, you get old people with disabilities as well. So multiple layers of discrimination we're going to talk about later. Can we also, from researchers showing us that refugees with disabilities are often forgotten or invisible during acute crises of human displacement. Nobody's been speaking about that today. And we know, again, Ricardo and Lauren were talking about earlier, not enough data on exact numbers and some of the challenges that if we don't have the data, how can we prepare and plan ahead and just manage our resources? We don't know who are we serving as well. And another thing that we really need to focus on is including more studies on the lived experiences of people with disabilities. Because often, we do research, but we what are their voices? What do they feel is needed? And that's a big push. And there's some studies showing the significant need of hearing the voices of people with disabilities. Okay, we know that the vast majority of forced refugees live in the global south and often originate from or hosted by the poorest countries in the globe. And we know that there's a strong link between poor people or more vulnerable to impairments, okay, and encounter greater barriers. And if we look during COVID-19, we look at the barriers that people with disabilities experience trying to access healthcare, and access to healthcare as well as education, all of those factors. So more likely to exacerbate the poorer people. Okay, and these barriers are intensified through forced migration process, from fleeing from their homes, as well as the breakdown in support structures and community relationships that accompanies this trajectory. So we're leaving our homes, our communities, our families for a better life, or to flee from, as we said, some of those factors, and they lose so many of those support structures. And what happens is results in the rights as well as the needs of refugees with disabilities being pushed to the edge. Okay, we don't hear their voices, we don't focus on them, us versus them happens a lot. Okay, and often people with disabilities' rights are ignored. And forced displacement, as I said, disproportionately affects people with disabilities. We've spoken about that earlier. And often, again, we know that people with disabilities are at higher risk for violence, higher risk for exploitation and abuse, and they often face barriers to access for even basic services, and often exclude from, as I said, education and livelihood opportunities. So jobs and workplace employment type of things. Yeah, the discrimination just oozes in so many different areas. Okay, and we look, as I said, multiple layers of disadvantage. Okay, because they could be hampered or discriminated directly or indirectly because of their impairment. Okay, and if we look at in certain of our countries, stigma attached to disability, and so that where you've left your country, you were discriminated, but you move to a new country, you flee to a new country, how a person, you've spoken about albinism, wheelchair users, people with psychosocial disabilities, stigma can be different in different contexts as well. So you could have, as I said, multiple layers of discrimination, language as well, and for example, the deaf community got sign languages as well, which should be different in different contexts. But and access. So we're not only talking about physical access. There are multiple layers of access that people with disabilities are discriminated against. And we've spoken about education, employment, and healthcare especially. And if we don't get the medication that we need, or our healthcare needs are not met, our conditions can deteriorate as well. And then indirectly, it's going to cost more money at a later stage when people's health does deteriorate than addressing them from the beginning. And if we think about a Black female refugee with a psychosocial disability, just think of the multiple layers of discrimination and disadvantage that they may face, again, in various sectors and spheres of life. Okay, so multiple disadvantage, negative assumptions. Many of us think, okay, well, people with disabilities, we don't really need to worry about them because they're not going to make it through pandemics. They're not going to make it through natural disasters. So actually, they're going to die. And also, oh no, well, they're not good. They can't travel because they're wheelchair users or because they're deaf. It's like, how does deafness impact a person's ability to run and to walk? But we make negative assumptions. And I'm going to talk about a little bit later about some of the negative assumptions linked to my disability. And during COVID, what happened there? Talk about that later. Okay, people are exiled from their countries of nationality or origin. They live without protection because they don't have citizenship. And many people with disabilities live in fear of persecution if returned back to their countries. I mean, I know that this is a common for all people, all refugees, but we've got layers, additional layers that impact on people with disabilities as well. So if we think about, I'm from Cape Town, South Africa, if we think about additional challenges, discrimination and xenophobia against our foreign nationals, and add disability to that as well. The fear and not feeling safe in the country that, so you may have left your country because of violence, and you move to a new country where you're getting attacked because of who you are. Multiple layers there. Okay, and yeah, just very few studies are focusing on the lived experiences, but found a couple. There's a wonderful master's degree study that was conducted, yeah, in the disability studies program at UCT, looking at Zimbabwean asylum seekers, Zimbabwe asylum seekers, their families, and living with their disabled children. And yeah, so this particular group of participants were discriminated based on the nationality, and yeah, significant impact of the costs around disability, but yeah, financial support not there anymore, and just looking at don't have access to care dependency grants, and yeah, also again limited access to disability support networks. So as organizations supporting people with disabilities, sometimes certain groups will say no, this money is for South Africans with disabilities. We can't now, our pot is so small, we can't split it between Zimbabweans with disabilities and this group and that group. So we also need to be, just look at how our organizations that are supporting the same disability category, but again, does where they come from and who they are impact on our resources as well, and our attitudes and unfounded assumptions as well. Okay, if we think about how does change happen, if we look in South Africa, for example, the ability to vote has changed our country dramatically. But if you don't have the right to vote because you're not in the particular country that you've moved to, you don't have a say in in who we vote into power. How do we change things? If we look at equality, for example, that happens through change. For example, voting systems and legislation. But if you don't have a right, if you're undocumented, for example, your feelings, your experiences, you don't have a say. Okay, so no citizenship, therefore no ability to vote in certain countries. Yeah, I mean, there was a lovely a study done by Kroc saying refugees with disabilities live in a state of permanent marginalization. We've spoken about the multiple layers. Okay, so having a disability, being disempowered and denationalized compounds the marginalization even further. Okay, we know we've got lovely policies, UNCRPD, and we understand from that view that impairment alone does not create the disability. It's rather the failure to accommodate, to adapt and assist that create barriers and disables people. Okay, so we're looking at external and intrinsic factors, but looking at the barriers in society and just how people with disabilities experience so many more, and refugees have got those layers on top of layers on top of layers. Okay, there was a study as well by Adonai and colleagues looking at African country study revealed that while the UNCRPD has inspired national disability frameworks, little explicit provision in domestic refugee protection systems has been made for the rights of refugees with disabilities, especially the right to equal recognition before the law, as well as the right to access justice. So what happens? Results in refugees with disabilities continue to encounter many difficulties in seeking protections accorded to them by Refugee Convention. We've been touching on that this morning, so it's lovely to see how all the different presenters are adding different layers to the story. Okay, yeah, so we've spoken about it, your refugee status, the type of disability you have, your gender, and other factors like language and culture, and all of those have significant impact on public's perceptions towards inclusion. If we look at children with disabilities who are refugees as well, many have battled to get access to quality education. Many experience multiple barriers and that impede full inclusion. And if we look at lots of our disability inclusive education research, it doesn't include children who are refugees with disabilities. So many areas that we still need to do research on. Okay, so I spoke to you about my experiences. I'm hearing impaired, my husband's quadriplegic, my one son's got a brain tumor and Tourette syndrome, so we live disability. But during apartheid, COVID-19, our triage policy in South Africa directly discriminated against people with physical disabilities. And so my colleague, Prof. Leslie Swartz from Stellenbosch University, and Vic, my husband, and myself, we really had to question and fight and write articles, do interviews to get awareness around we have equal rights as people with disabilities. We should be accessing ICU beds. We should be accessing ventilators. You can't discriminate against us based on our disability. And again, creating awareness, but whose lives are more valuable at saving COVID, whose lives are worth protecting from a refugee standpoint as well. Really need to question. And also people with disabilities, we need to take ownership. But if I don't have any rights and I don't have any agency, how can I fight for my rights? And again, especially disabilities that have stigma attached. It's multiple layer factors as well. Quick conclusion, no quick fixes. Change will take time. We spoke about it this morning. The importance of collaboration, of seeing what other people are doing, learning from each other's mistakes, sharing resources, ideas, and vital is strong integration policies. I'm very excited about certain documents being signed next week. We need to have efficient equality, anti-discrimination mechanisms, access to justice for all, and promotion of diversity at all different levels. And we also need, as I said, I spoke about that earlier, refugees with disabilities need to be empowered to defend their own rights politically, as well as judiciary, and express their lived experience. But again, I can say that, but I know that I'm standing in a place of privilege, whereas many other people with disabilities either are too fearful for sharing their experiences. And so I do understand that it's complex, but we need to make sure that we are integrating and including people with disabilities into our decisions, into recommendations, because their lived experiences are vital. Okay, we spoke about the need for data and more studies is vital. And whether it's organizations supporting people with disabilities or individuals with disabilities who have moved from different countries, their experiences are vital. And are the solutions that we're coming up with actually relevant? And what else do we need to think about is perfect. And that ties in with the disability slogan of nothing about us without us. Thank you very much. References there. Thank you.
Fantastic. Thank you so much, Emma, for that presentation. I think we all thoroughly enjoyed the 4 presentations that we've heard from this morning. So let's just take a few minutes to field any questions that we may have to the presenters, to any of the 4 presenters. If you have a question specifically directed at someone, please do state who your question is directed towards. And if it's general, just state that it's for anyone. So I'll start by taking questions in the room, and then we'll go back online. So within the room, is there anyone with questions for any of the presenters? Yes, please. So I see 2 hands. I'm going to start with you, sir, and then I'm going to move to Laura. Thank you.
Okay. Good morning, everyone, once again. So mine is not necessarily a question, but it's a general comment to the session and every one of us in this room. So the session looking at the impact of climate change on migration and displacement. It is interesting to see how a good number of African countries are trying to reduce the impact of climate change. And so my submission is that even as we do reforestation, afforestation, it is important that we also, as a disability movement, we should take part in empowering persons with disability to know how to actually survive the impact or the effects of climate change. Because if we look at the amount of greenhouse emissions that Africa contributes to the destruction of the ozone layer, it is somewhat insignificant. And so what we need to do is to begin to prepare how we are going to stand the impacts or the effects of climate change. Thank you.
Thank you for that, Laura.
Also a bit of a comment rather, and a positive note. In South Africa, refugees who are registered were able to access the registered refugees with disability were able to access the social grants. So that was a good a good advocacy outcome. Of course, this is a very small percentage of what we call forcibly displaced, because refugees who are registered are still a smaller percentage than what we have in terms of overall migrants and people on the move. But I have to say that for the registered one, the access to social grants was quite effective and a good advocacy with the South African government. The second point is a little bit more complicated, and I don't know if I'll be able to make it for all the speakers. Is there any way that we can see disability and forced displacement not only as persons with disability having an additional difficulty? Is there a way that we can see it also as an asset? Is there a way we can see the contribution? I don't know. I also myself didn't really dig into the narrative of the agency and contribution of persons with disabilities. So I was wondering if someone else can make the point a bit better than me. Over.
Okay, fantastic. So Maluka, we'll take your question and then pass it back to the presenters.
Thank you. I hope I can be heard. Yeah, so I have a question. I think we've discussed a lot about the impacts of climate change and what happens after, like floods and all that. I'm curious to know from the presenters if you had any information on climate change as a driver for migration for persons with disabilities particularly. Thank you.
Okay, thank you, Maluka. All right, so we've got 2 comments and 2 questions. Just to if any of the presenters want to make an additional comment on the comments, you're welcome to do that. But the 2 questions, just to yeah, if anyone, I don't think they were directed at anyone specifically, but if any of the presenters want to field any of those 2 questions, please go ahead.
Yeah, if I may just add a little bit to Lauren, in terms of hearing the voices and the stories, but also people with disabilities, we come up with creative solutions just to navigate our days on a daily basis. So sometimes the solutions that we will come up with are ones that people might never have thought of. And it might be actually less expensive, so more cost effective, more adaptable at scale. And yeah, again, so often it comes from a good place. We try our best, but we just sometimes, I mean, if I'm linking back to COVID, sometimes we didn't really get the opinions and the backing and the feedback. And then we said, well, why didn't it work? Because of there wasn't an engagement in certain of our other projects. So yeah, just as I said, we come up with creative solutions to navigate our day on a daily basis. We might come up with ideas and solutions and getting buy-in as well. And what works, we can't make assumptions that all people with albinism need X. All people who are wheelchair users need Y, because disability is such an individual experience, but there are some common threads that will tie everything together. So again, because if I don't have education or I'm living in a shack behind someone, my experience will be very different from someone like me who sits in a built house with public transport close to me. So yeah, just this big thing for me is just collaboration, input, and yeah, genuine listening. And what do you need? What do you recommend? And then see what compromise we can make in the middle. Thank you.
Anyone else?
Okay, yeah, so if I would take the question on climate change, the work that I've done around indigenous people, they are one of the best conservationists in the world. We look one of the best conserved forests, like the Amazon forest and forest in the Philippines and in Thailand and in Southern America, are conserved by indigenous people. the solution would be to integrate their ideas and their way of the way they interact with the environment into coming up with solutions. For example, indigenous people view the forest as alive, like people, and it's part of nature. So if the government, the civil society, and the rest of the communities are able to adapt, they're able to adapt the measures that indigenous people take, they can actually be part of the solution. So for me, I view indigenous people with disabilities from a point of solution givers, as opposed to not having the solutions and actually causing the problem. However, the biggest challenge that is out there is that when human rights are violated, it is very hard for these people to be able to be how do I put it, like useful members of the community. So if you don't have the right kind of housing, if you don't have health, if you don't have education rights, it is very hard for you to be able to be meaningful contributors in the society. So I would say from where I stand, indigenous communities are actually restoring the environment, and they are playing a big part in mitigating climate change as opposed to destroying it.
All right, thank you for that. I'll just check online if there's any hands online. I don't see any, but if you're online and you'd like to ask a question or make a comment, please go ahead and unmute. Okay, otherwise, if that is all, I think that marks the end of this particular session, session B. So I will now hand over to my colleague, Jahira, who is going to moderate the last session before lunch, session C. Jahira, please go ahead. Thank you.
Thank you so much, Diana. Good afternoon and good day, everybody. I'm over on this corner. I'll do the introductions. I think the camera will swing around in just a minute. So the session C, the topic is the role of media and the courts in the topic that we're talking about. And the first session we have is about word-sensitive media reporting on the rights of migrants and internally displaced persons with disabilities in Africa. And our presenter is going to be Johnson Mayamba. Johnson Mayamba is an award-winning journalist, activist, communication strategist, and media trainer. He has over 10 years of experience in human rights journalism as a reporter and an editor of the Daily Monitor. He is a media trainer with Journalists for Human Rights, a Canadian organization that builds the capacity of journalists in Africa. He trains and mentors colleagues to champion human rights in their reporting, and he's also the African regional correspondent for the Global Campus. He holds a bachelor's degree in mass communication from Uganda Christian University and a master's degree in human rights and democratization in Africa from the Center of Human Rights, University of Pretoria. The second presentation is for this session is courts and tribunals and the rights of migrants, internally displaced persons with disabilities. And our presenter is going to be Japhet Manyama. He's a senior resident magistrate of the Tanzania Judiciary. Japhet holds a diploma in law, an LLB, as well as an LLM degree. Japhet has successfully completed various short courses, including the Advanced Human Rights short course on the rights to development in Africa, and the Advanced Human Rights course on sexual minorities in Africa, offered by the Center for Human Rights, which are courses that we offer in the department. Karibuni to both our presenters, who are both going to be online, and we have 15 minutes each. Please post all your questions that you may have in the chat section, and we're going to start with Johnson. Karibu, and please proceed. We'll share your presentation now, so you can share it from your side. Johnson,
are you able to hear me?
now we can hear you. Do you want us to share your presentation or are you sharing?
Thank you so much. I'm trying to share it.
Johnson? Hello? Someone
I'll
had-
kindly share it.
No, we can't hear you.
Hear me
Maybe
now?
no, please remove your earphones and just speak directly. And plug the microphone, the earphones. Will we try?
Do you hear me now?
Yes, perfectly. Will you share on your side or do we share from this side, your presentation?
I'll kindly share the presentation.
Okay, please
Thank
start
you.
introducing as we share your presentation from our side. We don't have.
Thank you so much.
Samani Johnson.
As I've been introduced, I'm Johnson Mayamba. Yes.
We don't have your presentation. I'm being alerted. We do not have it. Do you have a PowerPoint presentation?
I have a PowerPoint presentation.
Are you able to share the screen?
Okay, let me. Sorry about that.
Japheth, might you be ready to start? You can start with either of you, whoever is ready to start their presentation. Apologies for the delay. I know the 30 minutes between you and your lunch. Dinner was delicious last night, so I'm hoping it's going to be more delicious, especially the desserts. So think about desserts, yeah? And hold on for the next 30 minutes or so as we have the final presentation. Japheth, are you ready? Can you share your presentation? Please start. I have a joke as we wait. Right? So we all know traffic lights or the robots, right? So what did the robots tell the car? What do you think the robot told the car? Stop? No. The traffic lights told the car, don't look, I'm changing. Yes. And
Hello?
we now have Johnson's presentation. Johnson.
Hello.
Hi. Hello. Yes. Is that Johnson or Japheth?
Johnson.
Johnson, we're ready for your presentation. Please.
I'm sorry for the technicalities. I'm talking about my presentation is about the sensitive media reporting on the rise of migrants and IDPs with disabilities in Africa. My name is Johnson Mayamba, as I've been introduced. I'm a media trainer and human rights journalist based in Uganda. Now, next slide, on slide 3, you could be asking yourself, why this particular topic? Why am I interested in it? And why should we all be concerned? As you are aware, media play an important role in terms of shaping societal attitudes, and hence cannot be ignored in our advocacy campaigns as we advocate for the rights of persons with disability, especially with exacerbated effects of climate change that have led to displacement and migration, and also conflicts that are widespread on our continent. Slide 4. I'll just continue. In this particular presentation, I'll be talking about how media has represented persons with disabilities. I also talk about the legal framework that are existent to guide the media on how to report about persons with disabilities. I also talk about what has been done, what more can be done. I also leave you with a takeaway, and also before we go into a discussion. Before we proceed, our previous speakers have already talked about, have already defined key terms as such as migration, migrants, displaced persons, and persons with disabilities. I'll not delve into that, but I would like to bring to your notice that a report by World Health Organization and World Bank stated that there are
Please carry on, because you have your presentation. Please carry on.
Okay. Stated that there are over 60 to 80 million persons with disabilities in Africa and over 1 billion in the whole world. Most of these are alienated and discriminated and are left out in terms of development, access to work and study. This calls for promotion of their human rights, but not only in other areas, but also including through how media reports about persons with disabilities. Now, there are so far 2 reports that I found during my research that reported about how media frames and labels persons with disabilities in Africa. One of them is Internews Network. It's a US-based NGO that carried out a survey in 2021 and found that Africa's media coverage of persons with disabilities has not been impressive and misrepresented this part of society. Coverage usually portrays persons with disabilities as weak links in need of sympathy. Another report by African Center for Media Excellence, which is based in East Africa, specifically in Uganda, carried out another survey in 2013, and the same report was revisited in 2017. It showed that a cursory analysis of Ugandan headline of newspaper headlines in Uganda portrayed disability and as weak links, and also used crude language and labels that entrenched negative cultural stereotypes. What are some of the labels that are used in describing persons with disability in media? One of them, some of the labels used include deaf, insane, crippled, mad, dumb, dwarf, retarded, among others. In terms of framing, the similar reports also showed, as I've already discussed, that it represents persons with disabilities as weak links, but also found that media represents persons with disabilities as pitiful charity cases, people who are loveless and sexless, and people who are less human. Now you could be asking yourself, does it really matter? Why should we care? I should bring to your notice, I should remind you that if words really didn't matter, I don't think we would have had the Rwanda genocide, because the media labeled the Tutsi as Inyezi, meaning cockroaches. This contributed to the Rwandan genocide that's so close to a million people killed. Although the media did not carry directly weapons to exterminate Tutsi and moderate Hutu of the moderator Hutu, reinforcing the hurtful labels significantly fueled stereotypes and eventually led to the genocide. You could be asking yourself, but why can't media follow their rules, code of ethics? Why can't they do their work as they're supposed to do it? First, I'll let you know that the cardinal roles of media is to inform, educate, and entertain the public. But during the launch of the Internews reports that I earlier mentioned, one of the editors from Nation Media Group, which is the largest media group in East and Central Africa with many platforms, said, we own up to our mistakes that we have done in the past. But unfortunately, our journalists are ignorant, and it goes back to training. She went ahead to say that at one time she posted a Facebook post saying persons living with disabilities. And that's when she was told how politically incorrect and insensitive such a phrase was to mention. I must also admit that I am not an expert. I'm always learning every day of my life, finding information on how to best describe and sensitively portray the stories of persons with disabilities. Now, how has media covered persons with disabilities and migrants that have been displaced? How it has portrayed persons with disabilities who have migrated and also those who have been displaced? There is this particular story that was carried in Newsframe. It's based in South Africa. It says life is so tight for Joburg's blind migrants. As earlier talked about, this story, if you go deeper into what it is written, it still portrays persons with disabilities, especially those who have migrated and been displaced, as weaklings. In one of the captions, it says, Madre, in his room, in one of Joburg's dark buildings, he begged for a living until recently when poor health forced him to stop. Most people use these words without really paying attention to them. Using the word beg, it shows it is degrading, in my opinion. And I also found conflicting media tools, as we shall discuss it ahead, that say it is right to say the blind. Others say you can say it's not right. You can say persons who are visually impaired. Oh, no, persons with visual impairment. Like that is the correct way. But then there are those who say it is not wrong to say the blind or blind persons. So in this discussion, as we go forward, I think you also guide me on how to best understand and represent our persons with disabilities, and also how we can help other persons in media to well represent our stories of persons with disabilities, especially those who have been displaced and those who are migrating. The next story says albino, Tanzanian albino children escape machete wielding attackers. I found, like still in the course of the research, there were conflicting discussions. Some said the community, there are different communities that that are okay to be called albinos, like in some countries that are called that is okay to call persons with albinism as albinos. Others contradicted on that and said it's not correct. Still, in the next slide, without freedom to touch, blind migrants disoriented in virus hit South Africa. Still, the word blind migrant, is it blind migrant? Is it the blind migrant, or is it persons, a migrant with visual impairment? In the next story, you'll see that while you may think the headline is correct, but then when you read deeper in the story, there's the way it frames persons with disabilities. Earlier on, I was listening to various speakers that spoke before my presentation, and they were okay calling persons with disabilities as disabled people. Now, those are the conflicting terms that media struggles with, especially in terms of reporting on persons with disabilities. In some societies or some areas, it's okay to say disabled persons, while others, they're not okay to say disabled persons. There are various conventions, of course, to guide media on how to report on persons with disabilities. The CRPD under Article 8 and its optional protocol under Article 21 requires states to raise awareness and combat stereotypes related to persons with disabilities, including by encouraging all media to portray persons with disabilities in a manner consistent with the respect for human rights. The African Disability Protocol also notes under Article 4 that state parties shall take appropriate and effective measures, including policy, legislation, administrative, institutional and budgetary steps to ensure respect, promote, protect, and fulfill the rights and dignity of persons with disability without discrimination on this basis. Now, these are instruments that are in place to guide the media. But then I went further ahead to inquire, what has the African Union done to guide the states and the media on the reporting of, on the sensitive reporting of persons with disability? I found out that there were different media tools contained in this docket that was developed by the United Nations Department of Economic and Social Affairs, the Division of Social Policy and Development. However, it lacked a specific component that is directed to how media reports about persons with disability. I think that is a gap that needs to be addressed. But going forward, I also looked at other different media tools that have been developed internationally to guide the media on how to sensitively report about persons with disabilities. Among the guidelines included that the media should not assume how to refer to the person, but instead they should ask someone how they prefer to be referred to. The second guideline is during the process of story reporting, media should focus on the strength and achievement rather than focusing on their disability. Also, in terms of communicating with persons with disabilities, the media is guided to address the person with disabilities and not the companion that is guiding them around, because the persons with disabilities can communicate. Now, I'll let you know that in the run-up to the 2016 general election in Uganda, my area MP for Ugandans who are online and in this conference know better numbers. They came up with a strategy of training the media in sign language, but that died after elections because it was more of a campaign strategy for how to reach out to the persons with disabilities and how to help the media to communicate with persons with disabilities, especially those with hearing impairment. But that stopped there. Right now, media is still ignorant on how best they can communicate and address persons with disabilities. Among of the guidelines include that they should call persons with disabilities by their name and not calling them as disabled woman or disabled man. They're also called upon to use right wording, avoiding words like albino, but instead use say person with albinism. There were also the last guideline, like I had earlier talked about, some media personality think it's okay, it's better to call the persons with a visual impairment as those that are calling them visually challenged. That is said to be unacceptable. So these are the guidelines that have been put in place, but then there's more need for the media to be acquainted with. So what more can be done to help the media address these challenges? I put forward a number of recommendations. One, as we've already heard, that media is ignorant in terms of rightly and correctly portraying persons with disabilities. So there's need for more training to educate and sensitize the media on proper coverage of PWDs. I also call upon the persons that represent persons with disabilities, like community leaders, to be proactive in terms of interacting with the media. I will tell you that as an editor, we send reporters out to collect these stories, but then when it comes to the editing part in the newsroom, not every editor knows how to correctly address persons with disabilities. Sometimes like we sit in a very large, most newsrooms have just open spaces with workstations. So somebody will start and ask, how do I correctly represent this? But if there's no one that knows how to properly address persons with disabilities, it will just pass by. And the next day you sit in the media there will be stories that incorrectly and inaccurately represents persons with disability. The third recommendation I'm making is, we've always heard that nothing about us without us, meaning that there's need for inclusivity in handling stories of persons with disabilities. If we can't have more media trainings, I suggest that we should have a comprehensive tool that addresses these challenges and it be shared with media houses across our newsrooms in the continent. That can help guide, because if I need to ask and then there's no response from any who is aware of how to portray or correctly present persons with disabilities, then the stories just end up going the way they are. I also call upon leaders in our communities, especially those that are leading organizations and are leading the persons with disabilities, to speak up. If you see a mistake in the media, kindly approach that media platform that published it and let them know how to best describe persons with disabilities, and also to avoid similar cases and reentrenchment of the stereotypes and stigma on persons with disabilities. If you must forget anything that I've spoken today, always remember that language directly correlates with stigma. Images and stories in media deeply influence public opinion and establish societal norms. That's why we cannot afford to ignore the media and how it communicates the issues of persons with disabilities. Thank you so much, and I look forward to the discussion.
Thank you very much, Johnson. And thanks for your patience as well as we're sorting out the presentation issues on this side. Please keep any chats, any comments that you might have, any questions in the chat box, or just write them down. And now we'll move over to Japhet for the next presentation. Japhet, are you ready? Yes, you're there. Let me just let me share your presentation just now in one moment. Please carry on.
Yes, good afternoon. Yes, good afternoon. Hello.
Hello.
Do you hear me properly?
Yes. Yes, we can.
Okay.
Please proceed.
Good afternoon, all. Good afternoon, all.
Good afternoon.
Yeah, here I'm presenting from Tanzania. I'm still in the office. I was so busy since the morning. That's now I'm taking even my coffee. Yeah, thank you for this opportunity to present me on the topic of courts and tribunals and the rights of migrants and IDPs with disabilities. So here, as you can see, this building, these buildings refer the facilities of our courts in Tanzania. It's where my office also is located. The next page, please. Yeah, this is my profile. I think you have seen this the morning. Next page, please. Yeah, my presentation has 6 parts. That's which I will have just a general introduction, which is part 1, part 3, part 4, part 5, and part 6. Next slide, please. Then I'm starting with the general introduction. According to the World Report of Disabilities of 2011, it is estimated that more than 1 billion people in the world live with some form of disabilities. even me, here, as you can see, this disability is not a predictable thing. So even today you are able, but tomorrow you don't know. You may get even a clash. So this corresponds to 15% of the world population which have forms of disabilities, which is likely higher to those places with the displacement situations, which are caused by armed conflicts and violences, where people with disability are at high risk of the harassment, violence, intimidation, discrimination, exploitation, and the abuses, as having fled their homes. Their access to justice and other remedies are often limited because of displacement. As you can see, suppose all the people who see the photo there, they are traveling to seek for home passage. Now you find there's no place to stay. They are homeless. A lot of exploitation, discrimination, and abuse and harassment. So they cannot enjoy their rights to access to justice. Next slide, please. So even the forced displacement often affects people with disability who are likely to be at abandoned, helpless, as their disability is connected to difficulties in hearing or even in communicating. And as that, they are limited to access to services, including health services, education, information, is severely handicapped by the legal procedures accessing the right and effective remedies. A major aim of this paper, therefore, is to analyze on those areas of human rights that they have previously received little legal attention. This paper, as I've said, comprises four parts. Part one is, I will be dealing with the general introduction. Although general human rights protection has always, in theory, applied to disabled, took many years before the world realized that the rights of disabled are need attention, and that's changing the attitude and the approach to the person with disabilities. You know, these areas is the one which have been forgotten. No attention was taken by even a single state has taken the attention to this area. So they were just left in the idleness, nothing, no help, no what. Even attending the schools, it was very difficult. So in 1948, there was the Universal Declaration of Human Rights, outlining the fundamental rights, and that any person should enjoy under the sun. That Article 25 mentioned disability, starting that a right to standard of living adequate to health and the well-being himself of the including food, clothing, housing, and the medical care, and also social services for the security in the event of unemployment, sickness, disability, widowed, or old age of livelihood in circumstances beyond his control. So in 1948, now there was, and this article was created or enacted to protect at least being everybody should enjoy this word. That's another slide, please. Hello, another slide, please. So this area of human rights protection has always, please. Therefore, the Declaration for the International Human Rights is an instrument aimed at protecting. Please, come again, please. Therefore, this convention covers a broad range of rights which a person should be in need to recognize. So the United Nations standards set rules on equalization of opportunities of persons with disabilities. And the United Nations Convention on the Right of Persons with Disabilities, all regional levels, the African Union adopted the protocol to the African Charter on People's Rights on the Right of Persons with Disabilities in Africa. At the national level, we witnessed the passing of the Persons with Disabilities in Tanzania, the Disability Act of South Africa, Americans with the Disability Act of USA, the Right of Persons with Disability in India. So then the United Nations opened the door for these African states, including my country, Tanzania, to pass the law which would protect the rights of persons with disabilities. Even in USA, there was a specific laws to deal with disabilities. So in Tanzania now, people with disabilities are enjoying equal protection with the other persons. They have equal access to justice, equal access to health facilities, even to education facilities. All they are equal, no discrimination. Therefore, the United Nations on the right of people with disability, which has instruments which are concerned, which set the rules, which need to ensure safe enjoyment of human rights by disabled people. Upload the categorization of persons with disability and reaffirm that all persons with disability must enjoy all human rights and the fundamental freedom. Mind you, in Tanzania, our constitution set up the rules that every person must enjoy all the human rights and the fundamental freedom. One of our judges in Tanzania mentioned that those rights are not ornaments. They are there to protect all people, including those people with disabilities. Another slide, please. Another slide, please. Another slide, please. Hello.
It's taking just a minute to load. It's there now.
Okay. Okay. So, so those rights which a person with disabilities or displaced must be free from any torture, to be treated equally, must be recognized by the law, and must have a legal capacity. So must participate in sports, recreation centers, cultural life, freedom of movement and nationality, participate in political and the freedom from exploitation, violence and abuse, liberty, security of persons with legal protection. So even these, you can see these rights. Every person must enjoy them, including people with disabilities. In Tanzania, we have a special seat in our national parliament that persons with disabilities must have the seat. So from that point, we recognize them. We treat them equally with the other people. Generally, the convention and other instruments seeks to ensure that all people are equal. Now, in part 2, I want to see how rights of migrants and interned persons are violated and individuals, and how those gross violence can be prevented or minimized or eliminated completely. While in humanitarian crisis, and the displacement situation creates challenges for all individuals affected. These challenges are especially faced by persons with disabilities, whose vulnerables are increasing for a number of reasons. Challenges created by war, natural disasters, and other situations of rises compounded for persons with disabilities by physical communication and other situations. Another slide, please. Therefore, acknowledging that Article 11 of the Convention of the Rights of Persons with Disability require that state parties, in accordance with their obligation under international law, including international humanitarian law and international human rights law, all necessary measures to ensure the protection and the safety of persons with disability in situation of risk, including situation of armed conflicts, humanitarian emergencies, and the occurrence of natural disaster. Therefore, the CRDP clearly established a legal duty to protect persons with disabilities. Unfortunately, they still face significant barriers to realizing their human rights. In many countries, they are subject to violence and discrimination, being deprived of their rights to live independently, healthy and education set. Therefore, Their obligation established by CRDP clearly established. Therefore, Human Rights Watch recently reported a massive violation of rights of people with disabilities. For example, in Yemen, where an estimated 3 million people have been reflected, limited fuel, lack of electricity, and labeled covered streets limited to the ability of their disability, particularly those in wheelchairs, to move free around their community safe or access basic services. Next slide, please. Next slide. For instance, it has been felt that persons have become virtually imprisoned. In such situations of risk, families, people with disabilities are facing very, very difficulties. Nowhere to go to save themselves, or risk being killed to save disability. As a result, people are risky to be left behind. So whenever there is any problem, especially in armed areas or in natural disasters, the first person to be affected are those people with disabilities. For example, in Iraq, the Human Rights Watch documented the cases of children with disabilities behind the family members were forced to flee. The risk of persons with disabilities in emergency situations are increasing further, receiving information of being made aware of the danger they face. For instance, in Central African Republic, occurred without warning. Many people who were defeated, psychological and intellectual disability, simply did not know about what to do. So at the end of the day, they ended up being ignored. They were just being ignored. Since even the domestic disabilities organizations did not focus them with the physical disabilities. Next slide, please. In Central Africa again, the Human Rights Watch found that the children with disabilities did not have access to education services provided through the international-led response. Even children with physical disabilities are often unable to attend schools. This is very dangerous. This is very, very dangerous. So now, second, other slide, please. Now, adequate seating and the accommodation of parental concern, there is also a problem. In places with the armed conflicts, such countries of Syria, there are risks and the people with disability of conflict of results in persons with disability, gross violence of their rights on very disease. Now, you can see that photo there. You see children. They are walking with their parents with a lot of things carrying. So I think you can see this one. This is give us a picture how people with disabilities are being tortured. No assistance. They are just walking. Those poor people, they are just walking with their parents. Their mothers are there with their children. Generally, after the crisis, persons with disability are facing very, very serious barriers to accessing medical services and the basic necessities. Sometimes this is because the challenge is physically reaching the resources. The destruction of hospitals and other infrastructure in which persons with disability rely on shortage. Shortage of vital supplies limited to humanitarian access to all demand to them. Treated people, the injured in the accordance closing their services with disability. So whenever there's a clashes, those people with disabilities cannot access the necessary services. So to comply with Article 11 of the Convention on the Rights of the People with Disabilities, the violation of the rights of people can be prevented minimized or eliminated completed by following attempts by the state or government or donors on humanitarian agencies. That's to ensure that people with disabilities, including those with the newly acquired disabilities crisis, are explicitly identified as a high-risk population with the specific needs when the humanitarian crisis. So the first thing here is to identify those people who have disabilities. We should identify first those people who with disabilities because they have high risk. Secondly, to ensure that information related to and during situation of risk and responses accessible for individuals with a range of disabilities, including in sign languages and the formats. When there's evacuations undertaken, facilities accessible evacuation of persons with disabilities. Ensure that the basic services of persons with disabilities include equal treatment to food and non-food distribution. Provide adequate medical care, including medical health services, counseling, and psychological support. Help children with disabilities access to education by training teachers and making classes fully accessible. So the other countries, people with disabilities are just being left behind. Even the children now cannot access to education. This is a very bad thing in Africa. It's a very, very bad thing in Africa. In Africa, we are very happy to see other people not attending schools, even our children, because of war. But one of my friends told me that if want to test it, if you see election is expensive, try bullet. Another slide, please. Now, in part 3, the state, part 3, please. Implementation of right of people with disabilities by government and intergovernmental institutions such as African Union and the United Nations. International and the regional human rights law contains a number of provisions which particularly relevant to IDPs with disabilities, including the right to life, liberty, and the freedom from torture, cruelty, inhuman, degrading treatment, or punishment, or putting some form of slavery, to equal recognition and protection of the law and access to justice. In most cases, people with disabilities are being faced a lot of things. Therefore, a state is required to ensure that all relevant authorities and agents of the state respect these rights. Let me underline here. The state is required to ensure that all relevant authorities and agents of the state respect these rights by providing protection against any violation of these rights by third parties, and ensure that individuals are provided access to appropriate remedies when violation occurs. To that effect, national authorities should take all appropriate legislative, administrative, and executive measures to maintain law and order and strengthen civilian law enforcement, including through training and deployment of adequate number of civilian police, both female and male, including in and around camps and settlement and other areas inhabited by IDPs. So here, in most cases, people with disabilities or displaced persons should be treated properly by a trained civilian police. Must be both the female and the male. Another thing is to improve access to justice by strengthening formal and informal justice institutions, and in order to combat impunity, including by ensuring the prompt and thoroughly investigation and prosecution of alleged offenders, and to build the capacity of individuals and communities to protect themselves and recover from crimes, violence, and abuse, including by facilitating their access to life-saving assistance and services which can reduce exposure to such threats, such as adequate shelter, livelihood, and healthy care.
Jaffa?
Yes, proceed.
I'd want to ask that we move to the second last slide because of time.
Okay. Okay. Thank you.
Please proceed.
Okay. In spite of protection afforded under the international human rights law, in particularly hello, do you hear me properly?
No, let's do part 5 and part 6 only because we're already over time, please. Yes, we'll share your presentation.
Okay. Therefore, authorities and therefore, in conclusion, part 6, I can conclude that migrants and internally displaced persons, yeah. Hello, part 5. Part 6, please. Let me conclude because of time. Migrant and internally displaced persons with disabilities have legal capacity, and no one should have denied them access to justice on the basis of disabilities, facilities, and services universally accessible to ensure equal access to justice without any discrimination. So people with IDPs should be ensured equal access to justice without any discrimination. Thank you, guys. Thank you for listening to me. But because of time, I think my presentation will be shared all members of the conference. Thank you very much for the opportunity. Thank you, the center. See you next year.
Thank you very much. Round of applause. And also, thank you also because I think I want to recognize that doing this presentation in English may not be the quickest, fastest thing as a Kiswahili native and everyday speaker as in Tanzania. So thank you also for that, but we'll definitely share your presentation so that everybody can then be able to see all the brilliant things that you had to say. And at this point, I'd want to hand it over back to Diana. Thank you.
Thank you so much, Njahira, and thank you to the two presenters, Johnson and Japhet, for their wonderful presentations. So I think now we need to break for lunch. So let's have a break for lunch and then be back in this room at 2 o'clock for the final session in the afternoon. Thank you and enjoy your lunch. Okay, sorry, everyone. My apologies. So we wanted to take a group photo, so I've just talked with my colleague and he thinks it's best to do it now while we're all still in the room. So let's quickly have a group photo. For those online, maybe we can just do a screenshot. We can ask everyone to switch on their photos and do a screenshot. Do you think that works? Yes. Okay, he says yes. Yes, is okay. Let's do the ones for those who are present in the room. Thank you.
They can start some France.
Yeah, and if it goes down and you want to do a sport, that's like a class posing. Yeah. Yes. Exactly.
I think that's all right. I genuinely think that's all right. I think on 2, 3, 1 and cheese. I don't know. Oh, what's the convention? Oh, apologies. That person so we just need it for the website. So it doesn't pixelate. Thank you.
It's supposed to remind me, but I always forget to take it. Thanks. Yeah. She thinks Okay.
You can check them out.
Yes.
Check.
Good. 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 So this picture is how can I say oscuro?
It's big, small.
No, it is night, like a night.
Oh, lights.
Light. Yes.
Yeah. Dark.
Dark. What?
There are more lights. Like?
Yes. Very good.
Big more. As I I'll give him. I'll give
Thank you.
I'm checking myself and only present the house. How the show? The problem is that you want to change the job, but I think it's still managed. So keep checking money because money. Okay, right now I'm going to go back and get to where the house because I don't think it's got this group of me. Thank you. Bye. All right, guys. Just finish. Wonderful. Amplified performance to one trust in London. That you know so much about. Our process will never support them. And something going on short. The rule is never before. And what do you think of Everyone's great, man. Good to see our Nigerian brothers. And for each square, you know that thing? I didn't know that. Yeah, but don't worry, I love it. We are there. Police identity police on this square, but I had a baby of 10 years old. That's cool. I mean, you chop my own, that's all I know. Good job, all right. Good stuff, thank you. This is really like SC whistle around the head, follow not having this festival, today was a madness. Madness. She was hot, yo.
You watching see what's on TV? What? Look it up. What's on what?
I rock around Kokobar and watch it in Western TV. He's like, I'm just trying to go so much with all the lot of things. Western TV, especially I'm watching Western TV.
Something with that with me, but just that don't see. Nothing with that with me, but whenever down. Can't do without your love. Oh, in every situation. You are my redemption, you're my solution. Can't do without your love.
In time of trouble, time of sorrow, Chuku be careful. Abumoye, Chinechemo. You are a record now, yes, pleasure, I don't know, yes. Hallowed be your name. You are the hope, yes. You're the greatness. I will praise your name. Oh, my angel, and my guidance. You're my savior. I can't do without your love. For now,
Mheshimiwa Jaji, nisamehe bure ndugu yangu, nisamehe bure. Karibu Mheshimiwa Jaji, karibu. Pole Mheshimiwa Jaji. Nilikuwa na kikao cha maandalizi ya World Day. Asante, tulikuwa na kikao cha leo. Tunaanza mapema ndugu yangu. Tulikuwa na wadau. Tulikuwa na kikao. Utakuwa giza katikati hapo, utashindwa hata kula nini. Mimi sipokuwa nakaa nusu saa naandika. Nilikuwa kuchotikia naandika. Wenzangu nilikuwa nafanya presentation. Yakatokia South Africa tu.
Okay. My name is Pendo. I have albinism. This means I do not have enough melanin, the thing that gives harmful sun rays. My skin, hair, and eyes are much lighter than most people in my country and even people in my family. Because people don't understand about albinism, they believe a lot of things that are not true about me and other persons with albinism. Not too long ago, someone tried to kidnap me, but thankfully my mother and others protected me. I don't know who I can tell about the attack. I spoke to the police, but they said they do not know how to find the person. Others who saw the attempt kidnapping are too afraid to talk to them. My mother and I are too afraid to tell anyone else about it. We went to an organization of persons with albinism, and they told me that the government is supposed to protect me and others with albinism so that we do not get attacked. If someone like me is attacked, the government has to make sure the police find out who attacked them, why, and how. The government must train police, lawyers, and judges so they know how to help me. They must protect us and others who saw what happened so people are not afraid to help the police. It is very important that the government teaches everyone in the country that the things they believe about us are wrong. The attacker must be arrested, and everyone needs to know that if they attack someone with albinism, they will be punished. We have the right to protection by the government and legal bodies. As persons with albinism, we also deserve to be safe in our communities.
Good afternoon, everybody. I hope that you all enjoyed lunch. I always call this the dead hour. After lunch, our tummies are full and our eyes are starting to get tired as well, but let us not get tired now. We have had an amazing day of amazing presentations. So let's just continue with enthusiasm and excitement as we go into session D. In this session, we're going to be talking about the migration and displacement in the context of the humanitarian conflict. And I'm really excited we have two presentations that we're going to be joined with. The first presentation, we have 4 speakers who will be joining us. And the second presentation, we have Christophe Tejo, who's going to be presenting for us. I had the honor of having lunch with him as well. So I'm really excited to hear the presentations for today's session. So just a quick reminder for everybody who's joining us online, please just remember to keep your microphones muted so that we don't interrupt our speakers. And for everybody here in the audience, we know basic etiquette. Please make sure that our phones are on silent so that we can provide that respect to our speakers and really show that in the utmost. So every speaker, we have 15 minutes. Speakers, I will be keeping time on you. I always make a little bit of a joke. They ask the ADHD autistic person to try and keep time and interrupt people, 2 skills that I'm not fantastic at. But I promise you, one of the benefits of being autistic is I stick to rules. So I will stick to those rules and it will be 15 minutes and we'll make sure that it's 15 minutes. I'll be sitting at the side. And for those of you online, we will give you the time limit online, and for our presenters in person, we'll hold up paper for you so that you can keep track of time that way. And without further ado, I'd love to introduce our first group of speakers. They are going to be talking on the topic, evaluating the impact of insurgents on the rights of persons with disability in Nigeria. And joining us for this presentation, we have 4 speakers. We have John Funsho. Dr. John Funsho is a lecturer in the Department of Customary and Indigenous Law at the University of Nigeria. He obtained his LLB from Obafemi Awolowo University Ilefe in Nigeria and his LLM and PhD in law from the University of Nigeria. He is the editor-in-chief of Law and Policy Review, editor-of-chief in Petroleum, Natural Resources, and Environmental Law Journal, and he is the managing editor of the Nigeria Journal of Public Law and managing editorial editor of Journal of Contemporary Law. His research interests include law of arbitration, criminal law, and human rights. Joining Dr. John, we have Helen Jumbo, who is a solicitor and advocate of the Supreme Court of Nigeria. Helen obtained her LLB from the University of Nigeria and her LLM from the University of Aberdeen, where she is currently a doctoral candidate. Her research interests include environmental law and human rights. Joining both of them, we have Sylvester Anya, who holds a PhD in law. He is a senior lecturer and the immediate past head of Department of International and Comparative Law, Faculty of Law at the University of Nigeria. He has published a book on criminal justice and human rights law, as well as many scholarly articles in local, international, and impact-favored journals. He teaches criminal law and intellectual property law at the undergraduate level, as well as international criminal law and advanced criminal law at the postgraduate level. His current research focuses on criminal law and justice. And our last member of the group is Anastasia Ezi, who is a solicitor and advocate of the Supreme Court of Nigeria. Anastasia obtained an LLB from the University of Nigeria and her LLM from the University of Lagos, and is currently a doctoral candidate at the University of Nigeria. And her research interests include human rights and criminal law. We're so excited to have the 4 of you joining us today, and I'm sure everybody here is eager to hear the presentations after those bios. We're excited, we're ready, amazing speakers. So without further ado, over to you.
Hello, can you hear me? Hello?
Yes, we can hear you perfectly. Thank you.
Okay. Okay, to start my video. Mm. Mm. Can you see my slides?
We can't see
Hello?
your slides, unfortunately, but we can see your video.
You can see my video?
Yes, we can see your video, but not your slides.
Okay, I'm trying to work that out. Okay. What? Okay. Okay.
We can see your slides now.
Okay.
You're welcome to just push play and then we can continue from there. Thank you so much.
Okay, thank you. Okay, good afternoon, everyone. Thank you so much for the opportunity to present this paper. So I'm Helen Jumbo presenting on behalf of the group, which will also come in during the Q&A section. So the topic is evaluating the impact of insurgents on persons living with disability in Nigeria. I'll just go straight up into the introduction. So Nigeria is the largest country in Africa and over 200 million persons, and 29 million is said to have one disability or the other. So over the years, there have been series of insurgencies in the country, ranging from armed conflicts, the Boko Haram insurgents, Fulani headsmen, and so on and so forth, separatist agitations and different kind of crises that have been ongoing in the country. And this has had a huge impact on the economic of the country. It has have a huge impact on the lives of persons living in the country, but much more, it has had a huge impact on persons living with disability. So it has resulted in the event of internal displaced persons who are currently living in various camps in the country, and the plight of persons living with disability are not being catered for in these camps for persons living with disability. From the crisis to where they go to find safety, their plight are not being taken care of. So this paper seeks to address whether the plight of persons living with disabilities are being protected, their rights and their affairs are being catered for in events of insurgencies. And then the objective is to look at the legal frameworks applicable to know how adequate they are for the protection of the rights of persons living with disability in the event of these insecurities in Nigeria. So I'm going to look at different legislations from the International Convention on the Rights of Persons Living with Disability to the African Protocol, and then I'll look at the Kampala Convention, the International Convention, and then go straight to the national laws that are applicable. So for the Convention on the Rights of Persons with Disability, Article 11, okay. The Article 11 talks about that state parties should take into consideration measures for the protection of persons living with disability in the event of of crisis, insurgencies, armed conflicts, in line with the international humanitarian law and in line with the human rights laws. Okay. So sorry. So the African Protocol, also Article 12, talks about the right of persons living with disability to be protected in the event of this crisis, in the event of insurgencies and this crisis, ongoing crisis. So we also looked at the Kampala Convention. So we have also looked at the Kampala Convention, which also talked about the protection of. It first of all talked about the fact that insurgencies or armed conflicts are not legal and are criminal offense, and that the fact that this group of armed forces are not to inflict persons, internally displaced persons, or cause harm to them. Yeah, it provides that they should not cause harm to them. It also provides that vulnerable persons should be measures should be taken out to take care of these persons in events of armed conflicts, such as pregnant women, unaccompanied children, elderly ones, and also it also captures the fact that persons living with disabilities are vulnerable and they should be taken care of. And they should be taken care of in this crisis. So now I'll go on to the national legislations for Nigeria. So all these international conventions, they did not really stipulate measures or strategies that should be put in place for the protections of these persons. So it's left for the national provisions. It is left for state parties to provide measures and strategies under their framework for the protections of persons living with disability in the event of insurgency, crisis, and where they go to find safety in IDP camps. So the relevant Nigerian legislations are the Constitution, which provides for human rights, and also the Disability Acts, the Discrimination Against Persons with Disability Prohibition Act that was enacted in 2019, and the National Policy for the Inclusion of Internally Displaced Persons. So the the Disability Act in Nigeria, its article, its section 25 rather provides that that in all situations of armed conflict and crisis, persons living with disability, measures should be taken to protect them. But it does not go as far to stipulate this what should be done, the strategies that should be put in place, or the preparative measures, actions that should be taken for their protection. So going to the national policy, this policy framework, which is more or less a guideline, is more detailed in protecting the rights of persons with disability in Nigeria, or it provides for the impact of insecurity issues and its effect of displacing people from their homes and habitat, and also provides that measures should be taken for their protection. So the paragraph 3 specifically provides for vulnerable persons, such as persons living with disabilities, for the special cares that should be taken for them. It provides that they require specialized medication, specialized help, accessibility equipments for their mobility, and particularly for those that have issues with mobility. Also, their rights to information, to be able to have access to the aids, humanitarian aids for internally displaced persons. Okay. So it provides that if obstacles are on their way, they will not be able to access their rights in these internally displaced camps. So in our findings, the policy is a well-detailed framework. It provides for the rights of persons with disability to be taken care of in IDP camps. It provides that accessibility infrastructure should be made available for them. It provides that healthcare specifically for their needs should be targeted to what their needs should be provided for. But however, it's more or less a guideline. It's a guideline, it's a policy, and it is a guideline with no legal backing or enforcement powers. And so the impact of the provisions of this policy is not felt in the lives of persons living with disability in the event of crisis and insurgencies and conflicts. So looking at the evaluation or the experiences of persons living with disability in crisis in Nigeria, although over the years, over time, in the last decade, the number of persons internally displaced camps have reduced. The impact of protection for the lives of persons with disability is not well taken care of in these displaced camps, where they go to find shelter. From when the crisis starts, from the beginning of the crisis of them being displaced from their homes to where they go to find shelter in these camps, their rights are not, or they are not being protected. It's the event that a lot of them even have further disabilities. They do not have access to welfare materials, inaccessibility to infrastructures, and so on and so forth. This has been their plight, and this has been their plight irrespective of the legal frameworks that are on ground. We have the Discrimination Act and the national policy, which has a rich provision for their protection, in as much as that their rights and interests and affairs are not being taken care of in the internally displaced camps where they go to find shelter. So this is why it is we hold that the plight of the insecurity, it has more impact on persons living with disability, because coupled with the fact that life is not being fair on them, from them being displaced from their homes, their affairs are not also being looked into in wherever they go to find their shelter in the displacement camps we have in the country. So in conclusion, it is obvious that despite the frameworks that we have providing for the protection of their rights during crisis, insurgents, and conflicts, it's a mere provision on paper, and it's not being implemented, it's not being enforced. And looking at the frameworks that we have, it just makes provisions without being enforced. And so we have made some recommendations that will help to improve the lives of persons living with disability in the event of this crisis. Number one, we stated that priority should be given to their issues. Priority should be given to them in internally displaced camps or in the event of this crisis, so that, because they are more vulnerable, and so priority should be given to them in terms of rescue and provisions for relief materials. Also, we also talked about the fact that the legal framework should be reviewed in order to capture the measures or strategies that are provided in the policy, which has no legal backing. This should be factored into the Discrimination Act in order for it to have legal backing and enforcement powers, so that this would be strictly adhered to. Sorry about that. So also, we also recommended that the consultation should be their affairs, persons living with disability in this internally displaced camps, they should be consulted in taking into consideration their affairs. They should also have representations in meetings or in meetings or in peace in meetings regarding their interests concerning insecurity in Nigeria. And also, we also recommended that that needs framework should be put in place to manage the distribution of their relief materials in the IDP camp, so that corruption will be managed, and these relief materials will get to those that are vulnerable also, as well as other citizens. So thank you very much for listening to our presentation. We're open for any questions, and my colleagues are here to also contribute to the question and answer. Thank you very much.
Thank you so much for that informative presentation. I'm sure that we can all agree that there were some really important points that were raised and some valuable recommendations that were raised as well. Does anybody have any questions from the floor or online? Okay, all right. One question, yes.
Thank you very much. It's not a question, but it's perhaps a comment and an inquiry about the terminology used. They keep saying person living with disabilities.
The terminology.
Yes.
Correct.
Yeah, I think we should revise that. Otherwise, we will be going back for the medical model of disability. If we say person, it's almost like a person living with HIV, a person living with, but I think the correct terminology should be person with disabilities. In French, they say person living with disabilities, and it translates person with disability to person with disability, but in English, it doesn't work.
Thank you so much for that comment. I think that's a very valuable comment. We know that our language holds so much weight, especially when working with people with disabilities. Do you have any comments or anything you would like to say to that or respond to that to our speakers?
All right. Thank you for that comment or what you pointed out. That will be taken into consideration when reviewing the paper. Thank you very much for that.
Perfect, thank you. Any more comments or feedbacks from the audience? Okay, all right, we're going to move on to our next speaker. It gives me a great...
All right. Thank you very much.
Thank you so much. Let's give a round of applause for our speakers. Thank you so much. Thank you for your presentation. So it gives me a great honor to introduce Dr. Christophe Chujo. And if I may be as bold as to say, as of today, he has a beautiful granddaughter named after him. So that's also exciting news. Thank you so much for being here, even though your family is growing. I do have a long bio to read for you. Okay, if I read it with you here.
Answered well. Answered well. I mean, now, yes. No, it's not in the.
Sorry, participants online, can we ask that you mute your microphones, please? Thank you.
I'm actually not 100% done. Does this work for the slides?
No, the slides are
okay. Yeah. All right, the slides are handled elsewhere. Okay, so we have Christophe Chujo, and he holds a master's degree in law and is a barrister at law. He was called to the Cameroon Bar Association since the month of December 2000, and he is a human rights activist and defender with more than 20 years of experience in defending the rights of vulnerable persons in general, and particularly the rights of persons with disabilities. Furthermore, he's a vice president of the Social Affairs Commission of the Cameroon Bar Association and the national president of Wellbeing Africa Association, an organization that deals with the promotion and the defense of the rights of vulnerable persons in general, and particularly the rights of persons with disabilities. His professional career includes the defense of vulnerable persons in courts, providing legal advice, technical support in trainings and workshops, drafting of advocacy documents, and the monitoring and evaluation in the field of the human rights of persons with disabilities. Dr. Chujo Christophe, sorry, my mistake, Barrister Chujo, has the capacity to work at the national and international level on the implementation of human rights. He has considerable experience in collecting data, drafting strategic documents, and the management of multidisciplinary teams in charge of implementing programs. He's worked on numerous projects under the auspices of Transparency International, UNICEF, and Liliana Foundation. He perfectly masters, I love this, he perfectly masters the French language and has fairly good knowledge of the English language. Barrister Chujo is the co-author of the Cameroon and Gabon country reports for the African Disability Rights Yearbook for 2013 and 2014, respectively. Thank you so much for joining us today. We look forward to your presentation. Thank you.
Thank you.
Yes, our first thanks the organizer for having invited me here and to permit me to talk about the migration and displacement of persons with disabilities in the context of conflict in Cameroon, my country. I'll begin by the overview of this work, talking about context, the legal protective measures for persons with disabilities on international plan and the national legal instrument. I'll then talk about the condition of the people with disabilities in Cameroon during the normal period and within the conflict, in the context of the conflict as now. Then we will see that persons with disabilities are excluded from public initiative, even from public initiative seeking solution to this crisis. The next. The next. Yes. The context. Cameroon has been plagued by the security crisis since 2013. 3 areas of the countries are now concerned. In the east, the country has been affected by the aftermath of the political and social tension that are shaking its neighbors, the Central African Republic. In the far north, the abuses of Boko Haram sect continue to maintain a climate of insecurity. Then since 2016, the Northwest and the Southwest regions are in real conflict, which oppose the National Army to the separatist groups. Displacement persons are migrants, all of whom fall into the category of forced migrants, are matters of major concerns. The next. The United Nations Convention on the Right of Persons with Disabilities obliges state parties to guarantee on a basis of equality with others the right to freedom of movement, the right to freely choose their residence, and the right to a nationality, and to take all necessary measures to ensure the protection and safety of the person with disabilities in situation of risk, including armed conflict as now, humanitarian crisis, and natural disaster. According to the WHO, about 15% of the world population has disability. About 5% of the Cameroonian population has disability. If we apply this estimate to the nearly 2 million migrants and internally displaced persons, this means that approximately nearly 1 million of them could each have a disability. The next. We'll move then to the legal protective measure for persons with disability, international and national instrument. In the interest of the time, I will simply say that Cameroon is a party to more international treaties for protection disability rights, and the country has also adopted a comprehensive legal and policy framework for the protection of disability rights. Next. Concerning the condition of persons with disability in Cameroon in time of peace, in ordinary period. We know that persons with disability are victims of negative perception of disabilities, stigmatization, and generally they are left behind by their family and the society at large. Those in school are kept in special one with specific assistance. Then the condition in the context of armed conflict as now. People with disability or their relatives are simply killed. They cannot run, they cannot speak, they cannot hear, some cannot see. Due to these impairments, they are usually collateral victims of the conflicts. The next slide. People with disability are victims of new injuries, various forms of discrimination and face obstacles of all kinds. Displacement and migrant persons with disabilities face physical, environmental, and societal barriers that prevent them from accessing accurate travel information, assistance, and humanitarian services, including education, employment, health care, and social protection, and more generally to obstacle to the full enjoyment of their human rights, including the right to participate in the society on an equal basis with others. Displaced persons with disability often face multiple and intersecting forms of discrimination on other grounds, such as gender, age, ethnicity, religion, group membership, and displacement. They always lose even their properties. A person with disability testified, "My house was razed. I was lucky enough to be able to escape thanks to a friend who carried me, but I lost everything, including my wheelchair, and now I have no way to get around independently." They are abandoned, they are almost abandoned in flight by their family and their relatives. During some attacks, people with disability with mobility difficulties were unable to fly with their families. For example, a 27-year-old woman paralyzed in her left legs from childhood polio said she was abandoned in her village by her family in the Northwest region in March 2018. Another example is the case of Promise Nanje, 16-year-old boy who was found in a bush 3 days after being abandoned by his parents who were escaping in the locality of Kony in the Southwest region. In armed conflict, people with disability lost their dignity as human beings. People with disability who have managed to flee the violence have struggled to obtain basic humanitarian assistance in the areas to which they have been displaced. The next slide. Certain group or certain category of displaced persons with disabilities are particularly vulnerable to the violence, isolation, or neglect, particularly those in direct need of support, such as persons with psychosocial or intellectual disabilities. Women and other people with disability also face more issue of stigma, discrimination as a result of the country. Yeah. The exclusion of persons with disability from public initiative seeking solution to the crisis. The example of the major national dialogue called Grand Dialogue National. At the end of 2019, the Cameroonian head of state convened meetings called Grand Dialogue National with a view to resolving the Anglophone crisis in Cameroon. Chaired in his place by Prime Minister Joseph Dion Gute, this body took place from September 30 to October 4, 2019 at the Yaoundé Conference Center. Persons with disabilities and their association were not included, although they are major victims of this conflict. Then in the next line, we see a way forward for the protection of persons with disability in conflict in Cameroon. In terms of prospect, we believe that to effectively protect and promote the right of displaced and migrant disabled people, there is a need to strongly sensitize the national community without exception on the need and urgency of social inclusion. Need to empower people with disability to actively participate in the decision-making that affect them, to provide them with real assistance and humanitarian service accessible locally without exception. We think that the international community must invite the government of Cameroon to deposit within a reasonable time with the General Secretariat of the United Nations instrument of ratification of the United Convention on the Right of Persons with Disabilities. They should encourage the state of Cameroon to introduce the teaching of the right of persons with disability in Cameroonian universities. And to make this teaching possible, they should offer volunteer Cameroonian students training or bursaries in the field of disability rights. The international community should ensure that development assistance is informed by compliance disability rights. And that's the disability must be mainstreamed in humanitarian support service. Thank you.
Thank you so much, Chujo. What an informative presentation. I love the case studies. I think it's important we remember there are faces and people behind the stories we tell. Thank you very much. Thank you. All right, does anybody have any questions for Barrister Chujo, online or in person? Yes, sir.
Okay, thank you. Good afternoon. My question is directed to Dr. Chujo. I don't know if I've gotten the name correct. So when he was presenting, he tried to deduce the figures, the statistics of persons with disabilities within the conflict zone, the IDPs and the migrants. So I'm a bit worried, I don't know if it is the correct term, that noticing from what has been transpiring since in the morning, we do not actually have the figures, the statistics, the actual numbers of persons with disabilities. So then how can we account for them if we don't have the actual numbers? You look at the situation during the COVID pandemic, as I was discussing with the colleagues during lunch, almost every government in the world were able to track the persons who were infected with COVID-19, the recoveries and the deaths. So is it that difficult for governments or organizations to have the actual numbers? Going through the presentation, he actually spoke, he gave a case of a young boy who was abandoned in a bush for 3 days by the parents. I was asking myself, is it a matter of the community not knowing about the boy, or it was a matter of ignorance, or it goes back to this systematic accounting for persons with disabilities? It doesn't necessarily have to be directed to the speaker, maybe to the floor. Thank you.
Thank you very much. I think that's a very important question. Barrister Chijo, do you want to respond? Would you like to respond?
I'll try to say something concerning that. During this research, I wrote to the government, to the social affairs minister, to the social affairs ministry to ask for official data. They directed me to the regional delegations of the area touched by the conflict, the far north, the northwest, and the southwest. When I called the delegate for the southwest, she said that displacement and migration are private business. So then she asked me to know whether a disabled person must come in her office and signal that he is going or he is displaced himself. I asked to know whether the ministry, specifically in that area of conflict, does not have any data during the conflict or concerning disabled person. She said no. I don't know whether I can call it the poor data I have here. I've collected.
Sorry, just a reminder for everybody online, please can we just keep our mics muted? Thank you very much. Sorry to interrupt you.
The poor data, if I can say this, I got it from the civil society. Concerning, and this is why I said that in the way forward, in the recommendation, I said we must take really sensitization in global population. First, within the disabled themselves, because they do not know about their rights. Yes, they are mostly considered in the family as person with no value. They are abandoned by their families. They are behind their families, consequently behind the society at large. So this, we must take a large sensitization directed to the government and to the people at large, without exception. And I say that people with disability, the young one who has the chance to go to school, are kept in the special schools, a part of the society. And concerning the case of this young man, I have many. He was the case of Promise Nanje. He was abandoned by the mother because he was considered as an obstacle in their escaping, in the way escaping. And she left him in the bush. And he was found by the social activist girl 3 days after, when he was about to live the life. And he's now following the rehabilitation in hospital in Douala, not in the Southwest, because it still be the conflict zone until now.
Thank you very much. I think that
I have the case
yes.
of a father, Mr. Fombat, who received the visit of gunmen one day, and who forced everybody to leave. Everybody ran away, and this father he has mobility difficulties. He could not run away, and his son decided to place himself between him and the gunmen, and the gunmen shoot to death the son, and he died in front of his father, and they went away. So there are many cases, and the lack of data make us not to be able to have all those cases.
Yes. Thank you very much, Chijo.
Yeah, thank you. Thank you for the presentation. I'm a bit familiar with the literature in Cameroon on the issue, but I would like to say the issue of data is not unique to Cameroon. Disability research has been frustrated for many years, because if you don't have data, how do you plan to implement laws and policies for the empowerment of persons with disabilities? I say, and necessary assistance. Even if you say you want to do reasonable accommodations, if you don't have information, and in many of our countries in Africa, and in case of conflict, people will just tell you that a disability is a private matter, as he said, meaning the state will not be able to get to the conflict area to identify who has a disability and capture the numbers appropriately. Perhaps I want to give you one example on challenges to have data. I was privileged to be working with one of our countries that was preparing a state report to the UN Committee on the Rights of Persons with Disabilities. I was the so-called expert / consultant. And I arrived in the country and people were waiting for me, coming from outside to give them data in their own countries. Yet you have government representatives in the rooms. And now we had to add more days to the project because you are the focal point at the Department of Justice or Correctional Service. I will say to you, go and bring me the numbers, the data, but people in prison who have disabilities. I cannot give you those information. I can put together and pack it as per the template. But I'm saying this question is widespread. All the departments could not give any information. We had now to send them back, give them 2 days, and you could see the bosses run around to fight the staff. I want data, and that's how we managed to come up with a draft that we could not even complete. This is to say the question of data, it happens in Francophone Africa, in Anglophone Africa, in Lusophone Africa. So, and if we don't deal correctly with these issues during conflict and peace, the fight for equality is not ready to be won. Yeah, that perhaps my comment on this.
A very poignant point. Thank you so much for making it. Anybody else on the floor? Nino, I see your hands raised.
Thank you for the opportunity to speak. My name is Nenio. Do you understand my son? He asked the person sitting next to him from Cameroon. So my comment on the question that was just asked about why the government knows the stats for COVID, but they don't know the stat for disabled people or people living with disability, is because people living with disability are a minority, and the general public is a lot of people, and the government is mostly focused on winning votes and being in leadership instead of caring for the people. So if they focus on the minority, which is deaf, is people living with disability, then they won't be able to get the votes that they need to be in power. Thank you.
Thank you so much for your feedback. I think it's important that data is so important into making progress for the rights of people with disabilities. It's the foundation. And I think we've all echoed that from the questions to the feedback and to your feedback as well. So thank you so much for adding. I agree with that as well. Anybody else from the floor? Any more comments or questions? Last closing comments, last one. All right, perfect. Okay, we're going to wrap up this session and we're going to move on to the next session. Thank you all again to our amazing speakers, and thank you to everybody who engaged with the session. Let's just give our speakers one more round of applause. Thank you so much for being here.
Thank you for moderating so beautifully, Chelsea. I actually don't know if I can speak to all of you guys after she's done it so excellently. But in the interest of time, we won't have a quick health break, so we can just speed up the session. We are running it behind time. And so our next session will be on contemporary challenges. And we've got a lot of very interesting speakers. I know your program has got 4 speakers, but we'll only be having 3 who I will introduce now. And we will start with the topic on refugee rights to housing under the African Disability Protocol. And to lead this discussion and present on this will be Abi Ashenafi. And he is an international human rights lawyer and refugee law expert whose research and advocacy work focuses on the protection of the right of refugees, internally displaced people, asylum seekers, and migrants in Africa. Mr. Ashenafi is the manager of the migration unit at the Center for Human Rights at the University of Pretoria. Over to you, please, Abby. Just a reminder for our online participants to keep your mic muted. If you do have any comments, please feel free to type into the comments section or to raise your hand if you'd like to speak, and we will have an opportunity for discussion at the end of the presentations. Thank you.
Hey, you're there.
During that time that ASU was giving problem, I didn't follow the. I don't go to school again, except like today I went to Sam. How am I going there to do? When you got court order to compel me to go and work, and you told me that you're not paying me the work. What am I going?
Hello, everyone. My name is Zabi, as my colleague introduced.
and my topic relates to refugees' right to housing under the Africa Disability Protocol. Before I delve into the presentation, I would like to briefly give you the outline. First, I would like to discuss the protection of refugees' right to housing under the UN Refugee Convention, which unfortunately does not deal with persons with disabilities, but it has a specific provision on the right to housing under Article 21. Just in case anyone needs the slides, is it possible for me to connect it? Or can I just proceed? Okay, all right, okay. Oh, okay, okay. Okay, while joining the meeting, so as I said, the UN Refugee Convention does not provide for persons with disabilities, but it does provide for the right to housing, and also apologies, I think I need to proceed. I'm unable to connect. Okay. The good thing about the UN Refugee Convention is that under its Article 5, it allows state parties to extend the rights that it contains by enacting domestic legislation or by entering into other treaties. So if, for example, a state becomes party to the African Disability Protocol, which I will talk about later, and if the because the African Disability Protocol provides for the right to housing, then the African Disability Protocol will be applicable to refugees. This is just an example, but there are more pertinent treaties that protect the right to housing of refugees. I will now talk about the limitations of the UN Refugee Convention on the right to housing. The right to housing under the UN Refugee Convention has three main limitations. The first is that it only applies if housing is a subject of legislation or if it is controlled by the state. So if housing is under the private domain, it doesn't apply. I mean, refugees cannot claim that right from private actors. The other is this right or the right to housing under the UN Refugee Convention only applies to refugees lawfully staying. The term refugees lawfully staying is not defined, but there is a common understanding that it means that a refugee needs to stay in one country or in the asylum country for a couple of months, but not less than 3 months. The other limitation is that this right only applies to the extent that the right to housing in an asylum state is protected or protected in respect to other aliens, generally in similar circumstances. As I said, the UN Refugee Convention allows state parties to extend the rights that the convention contains. So now we go to the African human rights system, which has some human rights treaties that specifically deal with disability, and also that provide for the right to housing, as well as that specifically mention refugees. The primary treaty, human rights treaty in the African human rights system is the African Charter, but unfortunately it doesn't specifically provide for the right to housing. The good thing about it is that the African Commission, which is the monitoring body of the treaty, has in its jurisprudence given effect to the right to housing. For example, we can mention SERAC case. In its guidelines on socioeconomic rights as well, it has mentioned the right to housing. Finally, I'll talk about refugees with disabilities, right to adequate housing under the African Disability Protocol. The African Disability Protocol does not mention refugees. It's silent on whether its provisions apply to refugees, but it has a non-discrimination provision, which other treaty bodies, including the African Commission, have interpreted as applying to refugees. This protocol, the African Disability Protocol, provides for this right as a component of adequate standard of living under Article, which is recognized under Article 11, sub-Article 1 of the International Covenant on Economic, Social, and Cultural Rights. This right has been interpreted by the Committee on Economic, Social, and Cultural Rights, and it has 7 dimensions. The first dimension is the legal security of tenure, which means that a person must not be evicted or forcibly evicted from their homes, whether they are living in that home legally or illegally. Everything must be done in accordance with the international standard. The second is the availability of services and infrastructure. This is more pertinent, I guess, to persons with disabilities, including refugees with disabilities. Services like electricity, water, and infrastructure must be in place for a house to be considered as adequate housing. It must have services and infrastructure. It must also be accessible. Accessibility has information, 3 dimensions. It relates to information accessibility. It relates to physical accessibility, as well as access in terms of it can be ownership or access to live in a house, in a dwelling, or in a shelter. So it has a number of dimensions, but you can take whichever is more pertinent for persons with disabilities. The other dimension of the right to housing is affordability. Housing must be affordable for it to be considered as adequate. What does affordability mean? It means that a person to live in a house must not spend a significant amount of their income on housing and compromise other needs like education or other human needs. In some jurisdictions, they say that if you spend more than 30% of your income on housing, it means that you're in a serious housing need. The other dimension of adequate housing is habitability. This relates to whether housing has adequate space, whether it adequately protects you from the elements, meaning from the sun, wind, and rain, and whether it has it can protect you from physical traits. The other is location. Obviously, location relates to whether housing is located within close proximity to essential services and amenities like shops, bus stations, and schools, healthcare facilities. And housing must also conform to the cultures of the inhabitants. So these are the 7 dimensions which are essential to define the adequacy of housing. The African Disability Protocol adopts, as I said, the right to housing as contained under the International Covenant on Economic, Social, and Cultural Rights, which has been defined by the committee as having these 7 dimensions. The African Disability Protocol imposes 2 types of obligations on states in respect to housing. The first are general obligations, which relate to the obligation to respect, the obligation to promote, to protect, and to fulfill. The obligation to respect, obviously, is a negative obligation, which requires states not to infringe on, for example, the rights to housing of persons with disabilities. The obligation to promote can be interpreted as the obligation to spread information, to educate people or relevant authorities about the right to housing or other rights of persons with disabilities. The right to, the obligation to protect obviously requires states to put in place adequate legal and other measures to protect persons with disabilities from, their rights from being infringed by third parties. And most importantly, I guess, the obligation to fulfill requires states to step in by providing resources or other required dimensions of this right to persons with disabilities, refugees with disabilities. It also specifically requires states to allocate sufficient resources for the realization of the rights of persons with disabilities, the rights of persons with disabilities under the protocol, and to provide assistance and support to these people. It also has the second layer of obligations, specific obligations. The first is the obligation to ensure that refugees with disabilities, persons with disabilities, have access to various services and assistance for disability-related needs, including accessible housing. This is provided for under Article 20, Sub-Article 2A of the African Disability Protocol. The other obligation is that relates to housing is states must modify inaccessible infrastructure and ensure that all new infrastructure are universally designed. This is provided for under Article 15, subarticle 2A, 2E of the protocol. Housing must be physically accessible to persons with disabilities. Physical accessibility is not mentioned under the general comment of the International Covenant on Economic, Social, and Cultural Rights. It mentions accessibility, but it only mentions other dimensions of accessibility. So I think the African Commission, when adopting a general comment, deal with this particular issue. Equal treatment, it also imposes obligation on states to treat persons with disabilities equally with others. I'm not an expert on disability rights, but I think this equality clause means, imposes obligation on states to ensure substantive equality, but the protocol does not stipulate what kind of equality persons with disabilities must be accorded. And I think because it does not clearly stipulate whether persons with disabilities must be given priority access to housing provided by the state, I think this needs more elaboration. This gap also exists in the general comment of the Committee on Economic, Social, and Cultural Rights, when it talks about disability, equality or non-discrimination. For example, in its general comment 20, it doesn't talk about giving priority to persons with disabilities. And its general comment 4 as well, where it defines the right to housing. It states that vulnerable groups must be given priority, but it doesn't specifically mention persons with disabilities. This takes me to the end of my presentation. I have few recommendations. Accessibility, equality, in respect to equality, I think there is a need to specifically mention that substantive equality must be ensured, and priority to refugees with disabilities in housing should be accorded, and refugees with disabilities must be explicitly mentioned, and their peculiar situations must be addressed in general comments and domestic legislation. And finally, I haven't talked about this in my discussion, but refugee encampment must be abolished because refugees with disabilities have severe challenges in accessing services and materials in refugee camps. Thank you very much.
That clap wasn't strong enough. Let's give Abby another round of applause. Thank you for that, Abby. I think, one of the biggest takeaways from that is that even though the protocol doesn't explicitly mention refugees, there's some housing aspects that we can read in to apply to refugees, and especially refugees who have disabilities. And in the interest of time, we'll move along to our next more region-specific presentation. And this will be on migrants and disability in Southern Africa. And our presenter for this will be Teenage Rapatsa. He is a migration health project assistant with the International Organization for Migration, the IMO, with a Bachelor of Social Science, Public Relations, and Project Management. He has held various roles with experience in the migration sector over the past 17 years, including planning and project implementation. Over to you, Mr. Rapatsa.
Thank you very much, colleagues. I'm going to look. We're going to look at into migration, the nature of migration and disability in South Africa. So my presentation will be based mainly on the migration and disability and the study that we conducted in 2020 and 2021. Next slide, please. I would like to talk about the main drives of migration for a person living with disability, in South Africa. The main drivers of the migration for a person with disability in South Africa are as of those ones that are living without disability. They are not different. They are more complex and multifaceted. And people really people with disability they are moving or migrating from different reasons, ranging from political, social, economic, and personal factors. So those reasons are the push and the pull factors that are bringing people, pulling people to, and also pushing people to get out of their home countries or coming into South Africa. Some of these migrants, they are taking the irregular channels of migrating to come into SADC countries, mainly South Africa, because South Africa is one of the countries that have a lot of migrants in the SADC region. So they are also exposed to harmful migration experiences such as extortion, torture, sexual assault on their way to South Africa. And most of the migrants with disability in South Africa are originated from the continent of Africa, and mainly they are from Zimbabwe. Mostly they are from Zimbabwe and DRC. And when we talk about migration and disability, some cross-border migrants are hidden and they are hard to reach population because of the nature, some of them because of the nature of their travel or the nature of their migration. Especially if you are an irregular migrant, you have got no documents to show. You're also they're always fear of being deported, and also and the situation in South Africa at the moment, the issue of xenophobic attacks, the Operation Dudula and so forth. People are so afraid to come forward and there's also a lack of social cohesion, integration. There's not enough integration. There's not enough programs to integrate migrants into the society. So migrants living with disability are not accounted for. They are not accounted for the social welfare grant administered by the Social Welfare Services, SASSA. And that is one of the factors that push most of the migrants to depend on non-profit agencies and street begging. They are, I mean, if you go to you move around the streets, especially at the traffic lights, or at the malls entrance, mall entrance, the restaurant entrance, taxi ranks, and also the railway stations. There are a lot of migrants, the beggars who are people with disability who are begging. And we conducted the study and we found majority of the people, they are migrants who are on the street begging, is because they are not counted into the social welfare services or the grant that persons with disability are getting. So there's a need to advocate for their inclusion so that they can also access those services and enjoy those services. And it was also one of the things that came up, there was unconfirmed rumors of women trafficking of the people living with the people with disability for the purpose of begging on the streets, just like people who are pimping the sex workers. There are people who are mobilizing, but it's still hidden. We're still working towards, to find the rules, and also because when you talk about human trafficking, this is a crime against humanity. So make sure that people are, these cases are taken to the, they are taken to the police services and dealt with. So there's also lack of understanding of the link between migration and disability in Southern Africa as a whole. And there's also a lack of disaggregated data by disability. When we look at migration and disability data, is scarce in Southern Africa. The 2016 community survey report, it shows that the disability prevalence is at 7.7 data, and this 7.7%, and this data is disaggregated by sex, age, and ethnic groups. But it's not clear on how many of the 7.7 are cross-border migrants. Next slide, please. And also, we also, I just want to talk about the key findings that we came up with. It shows that there's a lack of reliable statistics on migration and disability. And it was also difficult to access it's also difficult to access the documents, for migrants to access the documents, especially if you are a migrant with living with or with disability. For you to go and access and also to follow the process of accessing the documentation is also difficult. And also the poor living condition of the migrants with disability. The living condition is not good. Some of them, they are living under the bridges. Some of, living in squatter camps. It's completely, the situation is completely not good for their situation. There's also limited social networks that can assist them. And there's also a challenge in accessing care and support. This is a very serious challenge because of because of the situation, because of the discrimination and the lack of information by the service providers on issues that concerning people with persons with disability. They are not even the people, the people who can speak at sign language at the health facilities. How do we expect them to access services? This is one of the key challenges that we need to work on. And also, the policies on disability, they are so silent on migration. They are so silent on migration. Yes, they are there. There are policies that speak to persons living with disability, but they are so quiet about migration. So some of these challenges faced by the migrants living with disability, there's also a need for counseling, and psychosocial services is also needed for our people. And there's also a fear for deportation. That is, I also mentioned previously that there's a fear for deportation. People are afraid to access services because they're afraid of being deported, especially if they are irregular migrants. Undocumented migrants, both with or without disability, they keep themselves hidden because of the so-called Operation Dudula movement that is in the country at the moment. They are so afraid to come out because of the movement. In part of the country in South Africa. Migrants with disabilities do not qualify for free assistive devices issued by the Department of Health, the UPFS. The uniform patient fee schedules is applied for they have to pay something. Then, just because they are migrants, but the services are free for everyone. There's a need for for us for everyone for us to advocate to get those services as well for free as locals, just like the locals. And also there's a problem of the language barrier of the health facilities. I've already alluded on this. And there's a stereotyping and negative attitudes and a stigmatization on migrant living with disability. Also a lack of documentation such as valid passport and permits. It also limits migrants, some of the migrants with disability to access services, because some services to access, they are going to require the documents. And if you don't have documents, you end up not accessing those services. Next slide, please. So the recommendations we need, there's a need for a greater mainstreaming of migration into national policies, plans, and strategies. We need to come up with a advocacy plan to make sure that they are included into those national policies and plans. But we already started to work on them as IOM and also and our partners as well. So and also there's a need to embark on misconceptions, misunderstanding, and negative stereotypes surrounding migration. And there's a need for education, to educate, sensitize, awareness, to raise awareness around migrants with disability is very essential. This is very essential. Next slide, please. And there's also a need for adequate and sustainable funding to target intervention that to address the specific needs for migrants with disability in Southern Africa, not only in South Africa. And there's also an urgent need for quantitative and qualitative data regarding the situation of a migrant with disability in the country. Ethnographic studies are critically needed to explore the everyday life experiences of migrants with disability, including those engaging in the street begging in South African cities. Thank you very much, colleagues. That is the end of my presentation.
Thank you, Mr. Rapatsa. I think, one of the most interesting things that you mentioned, which is very relevant, especially to this country, is how people who are coming in as migrants, whether with disabilities or not, are faced with a lot of xenophobia, and being a migrant with a disability then makes it even more difficult to navigate that transition. And thank you for giving us that experience of the migrant in Southern Africa and looking at the South African context. And I think it's also very topical for us to now speak about health and public health and migration, because a lot of the times you see people migrating to a different country, as in the Southern African context, for health and social services. And so without any further ado, I'd like to call upon Makhosi Letimile, and she's got a very short and brief bio. She describes herself as a disabled mom, a writer, a sexual health and pleasure advocate. And so over to you now, Makhosi. Thank you.
Thank you, everybody. I'll try and keep it short. We're very late. So my name is Makhosi Letimile. I'm a mom. I'm a disabled mother. I'm a writer. I call myself a reluctant activist as well. I'm a sex worker. I'm a sexual health and pleasure advocate, and I live in the Western Cape. Okay, so I started living as a disabled woman in 2016. I was in my early 30s. So when I first got sick, I was living in the Western Cape, and I was admitted to the rehab facility there for 6 months. And I'm a bit nervous. So after 6 months, they discharge you because you can only stay for a limited time. I relocated back to Joburg to go live with my parents, and try and get my life back together again. And when I first got to Joburg, because my parents' house is inaccessible, I moved to my aunt's house in the West Rand in Kagiso. It's a small township, very underdeveloped. And while I was there, my aunt and my grandmother were my caretakers. Okay, so because I was still recovering and I was still a TB patient, I had to go for my monthly medication and things like that. And because e-hailing it wasn't as functional as it is now in 2016, I had to use my wheelchair to get to the clinic because taxis also don't pick you up. And when I got to the clinic, they said to me, "Oh, great, we have TB treatment, but we don't have the TB treatment that you got in the Western Cape. So we need the Department of the Western Cape, the Department of Health in the Western Cape to send us your medication, or we're gonna have to give you something else that you're gonna have to take for 18 months. I gave them my details and they said to me, we'll let you know once the medication arrives. It's 2022, I'm still waiting. Anyway, so after about 2 months of living with my aunt, I decided to go back and live with my parents and try and make sense of my life. So my parents are in Pretoria. I use the Shawela Clinic as a primary care center. They sent me there for my checkups and my physio appointments, which I had once a month. But before I could actually get the help, I had to tweet the Department of Health of South Africa for weeks on end to ask them, can I get an appointment? Can I get an appointment? So it made me ask, what happens to people who can't get on Twitter and say to the government, but you know what, you guys are supposed to be providing this service, and then what's happening, you know? And so I would go once a month, you get to the rehab, and the toilets are not accessible, but it's supposed to be for people with disabilities. And then it worked for a while. While I was in Joburg, I needed a new cushion for my chair. And they said to me, write your details down. We'll call you once we have your chair for you. Again, I'm still waiting for my chair in 2022. So I had to get on Twitter again and ask, okay, so I need money. I need to fix my chair. And somebody from Twitter actually reached out and sent me money for me to go get my wheelchair fixed. So, and okay. So in the space that I was back home, it was a very conflicted space. I wasn't getting well physically. I wasn't living in a mentally healthy space. And there were, because my parents' house is inaccessible, there were weeks where I literally wouldn't see the sunshine, and it was killing me, you know. And so my friends realized that something was wrong, and they all decided that they're going to help me to relocate and get better. So we fundraised for 3 months, and they said to me, get to Cape Town, see if you can't get better, and then we'll figure out a plan when you get there. I moved to Cape Town, February 2019, with no job, with no money, with this 30,000 that my friends managed to raise for me. I paid rent for the 2 months, and I lived across the street from Grooteskiel. So when I got here, I actually called the clinic and I said to them, okay, so I was a patient and this is what's happening. They said to me, come in and we'll see what we can do. Within a week, I had an appointment and, you know, I'm getting assistance. What do you need? And I called my rehab, the Western Cape Rehab Center. And I told them, I've been in Joburg since 2016. I'm a patient of yours. Here's my patient number. The health system in the Western Cape is digitized. So when you have a patient number, you can move through the system and never get lost because you've got an ID, you know. So I called them, they set up an appointment for me. That was in March. In May, I went for my full bodily checkup and I got a new wheelchair and I only had to pay 45 rands for the admin fee. You know, so so that was my main reason for coming back to Cape Town, because I understood the accessibility that was here that I couldn't get in Joburg. So, okay. While I was living here, I was able to start using Uber. Yes, I lived across the street from Grooteskiel, but the roads are inaccessible. So you have to get an Uber to cross the streets, and then you get to the hospital, you get your assistance, and then you get another Uber to cross the streets again. But while I was on this welfare journey, I also discovered an alternative method of getting healthy. And anybody who knows me and vibrators, now is the time. And then, let's see. So being close to health centers meant that as an adult woman, I was able to take myself to the clinic, take myself to the hospital without needing a carer. Then COVID struck. COVID struck and my local clinic closed the accessible side of the clinic to accommodate everybody else. And people with disabilities were also left in the lurch, to an extent that now I had to go back to getting my brother to take me to the clinic, help me with the bumps. And it took about, they only just opened the other entrance again about 6 months ago. So COVID happened and people understood inaccessibility and plans were made. I mean, I used to have my medication delivered to my house. Immediately when the president said, stop wearing your mask, the clinic stopped delivering my medication. So now I have to leave the house again. So it's knowing that things are accessible and things are possible, but the government just chooses not to, or they do when they want, you know. But knowing that there's a system and things can work, it enrages me almost every day when I talk about it. And it's through this experience, my friends are still paying my rent. It's the only reason that I'm able to be housed, because I'm currently not working. And part of that, I believe, is because people, able-bodied people, treat the disabled as people who are dying. So when you go and you apply for a job, they don't really consider that you might actually need to earn a living, because to them, you're just facing mortality. I mean, we're all going to be dying at one point or another. So I don't get what that's about. Okay, so every time I'm on a stomach regimen, and every time I spend money to get laxatives or incontinence pads, my baby brother, who's also my carer, he reminds me how much money I spend to stay alive. And this is true, and it's unfortunate because I shouldn't have to spend so much money to be a living, healthy, disabled person in a country with resources that I know are available, you know. And then I complain about it, but I'm fortunate because the online community that I've built, that the only reason that I'm able to actually live and not starve to death, because society has written me off as a disabled person. And I'm not considered a migrant because I'm South African, but I had to migrate to one of the most expensive cities to live in this country in order for me to be able to get healthier. So what happens to people who can't afford to relocate to Cape Town? What happens to people who don't have online communities, you know? And how long does this also give me for my friends to keep making sure that I'm housed, you know, because I'm facing so many systematic barriers. And because of the questions that I ask myself, it makes me wonder what happens to non-South African people who live in this country with disabilities and have to manage the xenophobic violence and the ableism that they face daily when they need assistance. I had a friend who needed to go to the clinic, and then we get there, he's French speaking. And he was ignored because he couldn't explain what was wrong with him. I had to go to the nurse and say, actually, his English is really bad. This is what the problem is. So what happens when somebody doesn't have somebody to go and explain to the nurses, but this is what the problem is, and things like that. And basically that's my testimony for today. I'm hoping that with my ask about what happens to poor disabled people, we are able to go away from this, trying to find solutions or being part of the solution group. And thank you for your time, everybody. Yeah. And you can, I'm on Instagram, yeah, you can Gmail me, and if you have any questions, yeah. Thanks, everybody.
Let's give her another round of applause. Thank you for that, Makhosi, and I think for just sharing your own personal experience as well. I think that was very helpful for everyone in the room to actually see somebody who's living everything that we've been talking about through the conference. And I think one of the aspects of migration that a lot of people forget is also local movement within a country. So we often like to speak about, country to country, cross-border migration, but we're seeing that persons with disabilities within countries are also facing the same plight. And so it's very important for us to have those conversations. I'm going to leave maybe about 5 minutes if there's anyone who's got any question for Mahosi, Abby, or Mr. Rapatsa, or if it's any kind of contribution, feel free. Yeah, we've got someone at the back. You can use your microphone and then you can go next.
I just want to say thank you for bringing that angle, because I think it's so important that we talk about things like sex when we talk about disability or whatever other interests we might have, because those are the things that people without disabilities also talk about and engage in and, gossip to their friends about. And, people need to know that, people with disabilities aren't just sitting around thinking about disabilities all day long, So I just want to, say thank you that you are also just being an activist for pleasure. I'm really into it. Thank you.
Thank you very much. If I could talk about sexual pleasure and vibrators all the time, I would, but I don't think it's appropriate in this instance. But I'm on Instagram, I'm on Twitter, I talk about sex all the time, contact me.
Thank you for that. We've got one contribution here and the other one from the gentleman at the back. We'll start with you, ma'am, and then over to you.
All right. Hi, everyone. My name is Tatom Puti. To the young people known as Crutches Girl for obvious reasons. I think I just want to say thank you for your contribution, Mahosi. As a person who has devoted so much of their life in the space of sexual and reproductive health, because oftentimes our experiences are erased. And I think another thing that I just wanted to speak on, I think it was from the previous speaker's presentation, how in the presentation, or maybe it's in how the presentation was delivered, it felt like there's a detachment to our experiences as people with disabilities, but just wanting to move the message forward. And I think I just really want to make, or rather bring an invitation to say that if we are going to be speaking about experiences of people with disabilities, let us walk in their shoes, or let us be, embody those experiences and not just be in spaces to just tick off boxes, but understand that these are people's livelihood, these are people's lived experiences on a day-to-day. So yeah, I'll just leave it at that.
Thank you for that reminder, Tato. I think it is very important that regardless of whether you have a disability, you might have a disability, but it might not be the same as the person next to you. So it's always important to embody or try and understand the other person. So I think that's very important. And I think it's something that would carry not only in these discussions, but going forward in our different spheres of influence. I'll leave the gentleman at the back to give his comment now.
Thank you, Chair. My name is Latla Kumalo. I serve in the Presidential Working Group. So I just came in here to learn and listen. And I learned a lot today. What I'm trying to perhaps sense is from all the presentation, is this a question of the lack of policies or governments who are not signatories to the conventions? What is the thematic area around all these challenges that migrants are facing in the region? Because in all the case studies that I've had today from Zimbabwe to Cameroon, I'm not hearing whether is it a question of governments who have not ratified the treaties, or is just a question of absence of policies. Perhaps if someone as a closing can just highlight that part for me. And I also want to appreciate my host's story. I really enjoyed listening to her, and her testimony is a good story to tell. Thank you.
Thank you very much.
Is that an answer to his question? Yeah, you may go ahead.
Thank you. Yeah, this is a critical question, Tato, and thank you for asking that. You are asking an important question. I will say it's not a question of being party to these treaties or not. Most of our government, and I will say we live in a world that is prone to ability, meaning persons with disabilities are almost invisible because of the systemic, exclusion. And when it becomes systemic, they are just not seen. It's like they were not, like people with disability are not there. And I'm saying this again, I will illustrate this with an example where I had to run a training in Senegal with national focal points on disability, meaning every ministry and directorate should bring their staff working on disability. And I will tell you, all directors, there was no person with disabilities. And those persons with disabilities who were there were people to tick boxes. So what does it tell you? And I got so offended, I even picked up on those directors and say, you are the bosses, but none of you, men and women, has a disability. So what are you showing us? What? And someone said, you can say that because you are not based here. I say yes, because then they become vindictive. I say, I will say this, but tomorrow I'm on my plane back to wherever I came from. So it's a matter, and these countries, most of our countries, are party to the convention. Most of them now have been called to sign, to ratify the protocol. Cameroon had just ratified the convention, but we are waiting for them to give the instrument to the UN. The problem is not about whether people are party or not. I think it's the systemic exclusion that happens from school, that happens from everywhere. This is to say, and that's why I do a lot of advocacy work in this field. And everywhere we go, I'm telling you, it's like cut and paste, because those who are in highest office, you look at them, none of them in many countries. Now we have to kind of call them to order all the time. And they end up even, we say train people, don't just put them like windows dressing that they don't know. Capacitate people and empower them to be part of this conversation. So for me, I see the political will not being there in many of our countries, whether they've ratified or not. I will give you one last example. In Botswana, is the country that does not ratify much, but they implement. When you do study comparative analysis, Botswana will not ratify international treaties, but on the ground, they implement, they empower persons with disabilities. You see change. So we need to do more advocacy work. And that's why the story of Makusi is very important, to show that persons with disability are sexual people. They are sexual beings. But in some places, people consider people with disability like asexual people. And we need to be talking about this over and over again and have a chance to push this not only in theories, but in practice. Most of us, we are implementers of programs. If you have to implement a program, you get to a place, the bus that carry delegate to a conference like this, if the bus is not accessible, I shut the program down. And I do that so often, they say, this guy like trouble, because we will go to events where I have to coordinate things. I get to the hotel. Before we pay for this, I just make a turn. If your hotel, the bathroom is not accessible, the lift, there's no ramp, that hotel business, if you lose 3 businesses of that nature, you will think twice. You will think twice and make the place accessible for people. So I work on education. At my university or where I'm based, we had to take programs online. That was way before COVID. And we discussed everything. In fact, I wasn't part of it, but I was sent to represent my boss. And when it was time, the consultant had done everything to take everything online. And I sat and I said, so you guys are happy? They say, yes, it can go online by next week. I said, what of those who cannot see online? And you know the response? When we get there, we will cross that bridge. I said, I will not sign for it. I have the power of signature today. Sorry. So we have to be provocative and not trying to make friends. And the more you do that, the more they fix this. And I can tell you that program was fixed. It was prolonged for 6 months to become accessible to everyone. So we must be able in our daily work to discuss these issues and not keep it at level of policies. Because if those policies are adopted, because we have many, but if they are not implemented, they are useless. Yeah, so that will be my comments and response to it.
Thank you for highlighting the importance of implementation, Prof. I think in the interest of time, I'll just leave one last comment from Moluka, and then we'll wrap up the day.
So, thank you. I don't know why this happens with me. Okay, thank you. I'll try not to be too long. I think one is the point of clarification and a comment as well. And then I also, before I get on to that, I wanted to also thank Makhosi for her presentation. I think it was I asked in a previous session, what are the drivers for migration? And I think one of the things that she has brought out there is public health and access to inequality and access to healthcare as a driver for migration, but also highlighting the challenges of basically internally displaced persons within the country. And I think sometimes we may not consider that situation as a situation of an internally displaced person, but within the context that she gave, it highlights, issues of internally displaced persons. So I wanted to thank you, Makhosi, for your presentation there. And then I wanted to clarify the presentation made by Mr. Rapatsa, whether we were talking about a country situation, South Africa, or whether we were speaking about a regional situation of Southern Africa, because I think it was a bit confusing. Sometimes we talked about South Africa and sometimes Southern Africa, so if we can clarify that. And I also just wanted to comment in that context that, there was a lot of issues raised as well about, and I'm appreciative of that, about trafficking of persons with disability. And I wanted to highlight the issue of trafficking of persons with albinism. You will hear albinism a lot coming out of my mouth. I am the independent expert on albinism, and that's my job. But that is not to undermine any other disability. It's just that that's my focus, and that's why I say that. But I wanted to highlight the issue of trafficking of persons with albinism, which does not always fall within the context or within the definition, or people do not realize that it falls within the definition of trafficking. And that's basically when people are moved, whether internally or across borders, for the purposes of having their body parts removed. And when we talk about trafficking, we consider purposes of sex trafficking or work, labor trafficking and the like, but not always the purposes of a person's body part being removed. So I wanted to also maybe just as a question, ask whether any work is being done by the IOM specifically in relation to trafficking of persons with albinism for the purposes of having body parts removed.
Thank you for that, Moluka. I think that's for you, Mr. Rapatsa. The first question is on And the way that I understood it was that maybe he spoke a lot about South Africa because he mentioned that most of the migration that happens within Southern Africa is from people leaving the SADC region into South Africa. And so he was then explaining why the problems that those migrants are now facing within South Africa. But I think he could do a better job at explaining that. And the second question is on what is the IOM doing about persons with albinism who are being forcibly displaced through trafficking for body parts?
Thank you very much. In terms of whether the focus of the presentation, whether it was for the SADC or for South Africa, I was working on the research that was conducted here in South Africa. Most of the we did the research in other countries, but most of the issues they were in South Africa, because South Africa is mostly affected by migration. And also the issue of if in terms of women trafficking, if we also do work on addressing the issue of women trafficking for albinism people, for body parts and other stuff. We've never in our region, we've never done any separation. We treat women trafficking as we don't single out to say the albino for albinism people or for people with a disability. When it comes to women trafficking, we just treat it as a women trafficking. I think there's a need for that. We'll look into it.
Thanks for that, Moluka. I think one of the great things about conferences like this is that they actually open up dialogue like this. And I encourage everyone to use the breaks and the lunches and the dinners to really engage with each other and come up with possible partnerships on dealing with areas that we feel like there might be a gap, and what more we can do in terms of advocacy and as civil society and some government groups. Because of time, I will wrap up this session with one last very, very short presentation. You'll see that on all your tables, there's a red book, and that is our African Disability Rights Yearbook. And we are very fortunate today that we've got the editor for the yearbook, Prof. Surges, and he will come up and give us a bit of insight and tell us about this yearbook. Prof. Surges is also a professor of human rights law at the University of South Africa. So without any further ado, I'll ask that you come up, Prof. Thank you.
Thank you very much. Yeah, surely I will make sure that I keep it short. Yeah, I don't want to stand between your rest and and the evening. Just to say, I will start by saying good afternoon, colleagues. I was asked to say a few words about the yearbook, and I will just structure what I will say, let's say in 3 parts, just giving you a quick background of the yearbook, look at a bit at the content of the yearbook, and call on you to be involved, because it's open for all of us. So I will just say, after the adoption of the UN Convention on the Right of Persons with Disabilities, well, not even 4 years after, because in 2012, we were at the University of Pretoria and we were discussing, we look at the academic landscape of law journals and everything talking about law. And I will tell you, there was absolutely no journals, no academic journals looking at disability rights. The only journal that was talking of disability was the Journal of the Disability Policy. It's based, I think, at Stellenbosch University. So there was a conversation, and under the leadership of Professor Franz Fouillon, you may have met him in the morning, the director of the center. I don't know if he was here or online, but under his leadership, we decided that it was important to have a journal that will focus exclusively on disability rights. Together with the late Professor Christoph Hens, the former dean at UP and the former director of ICLA. So we had the meeting regarding the launch of such a journal. We had numerous meetings, and we were very fortunate to have Professor Charles Ngwena as our convening editor. So, and then we were four. There was Professor Ngwena, Professor Ellen Combrick, myself, Professor, I think at the time we have Ilse, and then later Dr. Nkata, the deputy director of the center. So we started with a conference like this. We definitely were supported financially. At this point, I don't want to be talking or giving you the names of those who supported the project. I don't know if it's appropriate. I wouldn't do that because I did not consult about telling you that, but we were very much supported. We had a conference, we started the journal, and in what we decided to do, we thought, because earlier today we were talking about data. We saw that the journal could not just be ordinary academic articles. We say, how can we get data from the continent? How can we be updated on developments that are taking place on the continent? And that's how we decided to structure the journal into 3 parts. Section A was and has been coordinated by Professor Ngwena, and Section A presents articles, normal articles like in any law journals. And Section B, that presents country reports to get data on what is taking place in all our countries. I'm the one who coordinates that section, and we have the recent development that is coordinated by Professor Combring. Again, and we've been assisted because at the time we did not have a disability unit like now. But I will say the creation of the unit has been a fantastic initiative, and we were very, very much assisted by Sabea sitting there. She makes things happen. She is junior to us, but she makes things happen. She makes us run, and in a very polite way. You are so exhausted, but when you see an email coming from Sabia and how far are you? You forget about exhaustion and you have to respond that. And she does that so, she is so wise. And all of us who are working in this journal, we know that sometimes we succeed in putting our articles out there because of her ability to manage us and to make sure that we deliver. She, in fact, I say she's our boss. You know, she's our boss. I think Dinah, with whom she works, is aware of that because she sometimes copied in some of the conversation, but Sabea makes the journal happen. So when I came in, I was fortunate to see the 2013, and this was the first edition of the journal. So I've been associated with the journal since the first edition 2013. So we've been working, chasing, pushing, trying our utmost best to get articles, to get countries reports. And we've been successful because since we started, we never skipped a year without publishing. And the good news about this journal is not just a brochure. It's accredited here in South Africa by the Department of Higher Education and Training. So when you publish here, you are known globally. You are known globally. It's not a small journal. And sometimes, and you know, I've published here only once before I became completely, because the first edition, we wanted people versed in the discourse. So we did the first edition because you need to have like 3 before you can apply for accreditation, so that the Department of Education should see that you are consistent, you are able to deliver. So we could do that. And some of us, as an editor, you can be self-publishing yourself. So we don't publish in the journal anymore. And what I want to say is you should all get involved. And it's very easy. The papers we are all presenting here, if we develop them properly, we can publish here. For those who want to do the country's report, please, it's open to everyone. You can simply send an email to Sabea and say, I'm interested in doing a country report. She will collect all this, and I will have my meeting with her, and we will see which country is yet to be done, or which one we can redo if necessary. And besides publishing in the journal, I will tell you, the disability rights field in Africa, there is so much opportunities there. We are so few who work on this. I did not do my doctorate in disability rights because when I came to start my doctorate, when I did that in 2005, I did not know about disability rights. So it happened that along the roads, I said, wow, but this is, and I could identify with the level of discrimination people with disabilities were or are experiencing. So because I cannot go in length, I'm just encouraging you to get involved. For those who want to further their studies, whatever you want to do, get in touch. We discuss proposal for master's, PhD, or even undergrad degree on how you can specialize in this field, because it's very much unexplored. There is a lot that we can contribute. And that's why you will see, if you check the yearbook, sometimes you see the same people contributing. It's because other people, you even invite them, they don't respond. They don't send you a country report. So sometimes it's difficult, like in this 2013, I had to squeeze Barrister Chijo there to give me a report on Cameroon, which he finally co-authored with someone. And I think in 2019, and every year I've been begging, but he never had time. Until lately, again, I squeezed him so hard, he gave me something on Gabon, because we published this in French and in English. And I'm also looking for Lusophone Africa, provided it's at least done in English. This is to invite you to contribute. For those who want to be involved, I think all of us, we have Sabeha email, all of us, because she's being the one organizing this and bringing us here and arranging everything. So we should be able to get in touch and see how we can be part of the conversation and be part of it. We can mentor you, we can guide you in becoming disability rights expert. And I say, this is a platform for all of us. And we should be thinking even of future new editors. We should not keep this like, this is Kamga stuff. This is no. we should all grow into this. And because we move on, and some other people must carry on, and the journal should keep growing for years. So I want to then thank you very much for giving me a chance to show this journal. And again, I use the opportunity to thank Sabea for her great job. Thank you. Thank you very much. Thank you.
Thank you so much for that, Prof. And again, an invitation to every one of us to submit articles for the yearbook. Like he mentioned, Sabia is your go-to person. You can send her an email, even if the article is not already written. If you've got any contribution that you'd like to make to the yearbook, they're always welcome. The 2021 yearbook, which is the red book, is available for all of you to take home. So please feel free and have a read when you have a chance. We've reached the end of day one of our conference, and I just want to thank all of you guys for being so participative and engaging in all of the conversations. We look forward to tomorrow, which will be our second and final day, and it is a jam-packed day, so I encourage you to get a lot of rest this evening. We are back at 9 a.m. tomorrow morning in this very same room. And so with that, I'd like to say thank you, everybody. Have a lovely evening.
I'm at Wheels and Toys on Instagram.